That's why. सुबह सुबह रात नहीं आ रहा.
Misra sir, have you joined?
Yes, I am already there.
Oh, acha, your name is different in Vipin Bharadwaj dikha raha hai. Sorry, sorry. Thank you, sir. Thank you for joining with us.
Okay. Okay.
Namaskar. Thank you. So, Arindam, I think we should start our program. Hello, Arindam, are you here?
Yes.
Uh, okay. So, sir has already joined, and Devashish sir has also joined. So, you may start.
Okay.
Thank you.
Good afternoon, everyone. On behalf of SAIARD, I Arindam, the Program Director of SAIARD, welcome all of you on today's webinar on COVID-19 and city management challenges and opportunities. COVID-19 pandemic has worstly affected the cities and has put sustainable and symbiotic urban development at stake. The development of the cities thought process has undergone manifold changes due to the multidimensional and be it culturally, economically, and environmentally. In this regard, the cities assumed a prominent role in its response to the prevailing situations. The Center for Urban and Built Environment CUBE has a comprehensive and transversal approach to the institute work in the urban context for implementation of 2030 Agenda for Sustainable Development. Keeping this in mind, CUBE would like to bring forward the urban actors, including mayors, local policymakers, and professionals, to help the city discussion makers in the reduction of the adverse effect that COVID-19 has meted out so that a sustainable and strengthened city can evolve. From this perspective, today's webinar can be an exemplary rendition for all. Now it is the moment when I want to invite Mr. Bishwajit Raichaudhuri, the chairman of SAIARD, to say a few words. Mr. Raichaudhuri, over to you.
Thank you, Arindam. Thank you for inviting me. And on behalf of South Asian Institute for Advanced Research and Development, first of all, I would like to give my special thanks to our honorable chief guest, Mr. Durga Shankar Misra sir, Honorable Secretary of Ministry of Urban and Housing Affairs, MOHUA, Government of India, and also our special guest of honor, Mr. Devashish Sen, Chairman, CMD of HITCO, Government of West Bengal, and also all other our resource persons who have joined, who have given their kind consent to be a part of this event. So you know that already Arindam has told about the focal theme of this event, and on behalf of this SAIARD, we have developed a center, that is the Center for Urban and Built Environment, with a vision to develop an platform where students, where researchers can get an opportunity to learn from the different aspects of urban subject as well as different issues, urban affairs related to the urban affairs. Along with that, it can be a part of policy making system as that it can support our government, both the state government and the central governments too, and particularly as we have developed it in eastern zone, keeping in mind also in the northeastern belt of India also. So with this platform, we are also having an interest to work on the support not only an academic and research institution based, but also in case of policy making sectors. We are honored that already we got some eminent personalities, those who have joined with us as our honorable advisory team. And also in future, we are planning to work on the different aspects of urban different issues, urban related issues, along with the application of technologies, because we have already developed another platform on behalf of SAIARD, that is the International Institute of Geospatial Science and Technology, where we are mostly focusing to implement the GIS and remote sensing technology, as well as the emerging technologies like AI, machine learning, data science, as that it can helpful, IoT also, as that it can be helpful for sustainable urban development and its basic integral development also. So with this, once again, I would like to thanks and especially Durga Shankar sir for giving his valuable time with us. And on behalf of that, hope we will get the assistance in future also in our activities, and we will get you also and your valuable support and advice also. So thank you. With this, I would like to conclude my uh, version and also hand over the microphone to Arindam. Thank you, Arindam.
Thank you, Mr. Raichaudhuri. Now it is the prestigious moment when I invite our chief guest, Mr. Durga Shankar Mishra, the Honorable Secretary, Ministry of Housing and Urban Affairs, Government of India, to deliver his valuable keynote speech. Mr. Durga Shankar Mishra, currently working as a Secretary to Government of India in the Ministry of Housing and Urban Affairs since June 2017. Mr. Durga Shankar Mishra belongs to 1984, the batch of the Indian Administrative Service from Uttar Pradesh, and he has held various senior assignments, union and state governments covering the revenue administration, internal security, vigilance, and civil aviation and tourism, sports, agriculture, research, taxation, and medical department. Mr. Mishra is an MBA and International Business batch of Electrical Engineering from IIT Kanpur, and Mr. Mishra is an MBA from International Business from University of Western Sydney, Australia, and postgraduate diploma in Public Policy from the Institute of Social Studies, the Hague, Netherlands, and he has taken keen interest in promoting the good governance and has published various papers on the subjects related to good governance, public administration, and development administration in national and international journal and books. He has represented the union and state government at various national and international fora and participated in such workshops, conferences. He has been visiting as a faculty in the University of Guelph, Canada, and he is a fond of trekking, sports, and tourism. So we are extremely privileged to have him with us today. So Mr. Durga Shankar Mishra sir, over to you. Sir, please unmute your microphone, please.
Is my voice being heard clearly?
Yes, yes, yes.
Okay. Dr. Roy Chaudhary, Mr. Arindam, and all the participants in this 2 days of webinar on a very important subject, which is COVID-19 and the city management, the challenges and opportunities. A very nicely worded subject matter to be deliberated in the next 2 days from 3 p.m. onwards on this digital platform. I congratulate you for choosing this subject. The South Asian Institute for Advanced Research and Development, SAIARD, and its Center for the Urban and the Built Environment, CUBE. This is a very pertinent subject, I mean, especially in view of the pandemic which the country has been facing since the last March 2020. We had the first wave, and we had a series of lockdowns, and after the lockdown, the economy started opening up, showing the good results. In fact, by end of the year, we had a lot of good results coming in the real estate sector, in various other sectors of the economy, and the predictions for the growth of the economy is going to be, I mean, we had around 12% plus growth predictions were there by the month of January or so. But then comes the second wave. The second wave came in the month of April. I mean, when everything was normal, the markets were open, the supermarkets, I mean, were open, cinema halls, the transport system, I mean, the people, the flights were going. In fact, I was traveling. I came to Kolkata in the month of, I think, in the month of February. So, I mean, I traveled across the country, various places, almost 3, 4 across the country. And then comes the pandemic again, the second wave, and everything gets halted again. I mean, this time, local lockdowns in certain cities, certain states, part of the states. This has been a series for the last maybe 1 month or so. And this time when it has come much more stronger. I mean, there have been a lot of casualty. I mean, the total number of cases had gone up as much as, say, around 400,000, which has come down now. That's a good sign. I mean, that's a very good sign. The way the country has addressed the first pandemic, we addressed so positively that across the globe, this was everybody praised. Everybody had a very good praise, appreciation for the way our country addressed the pandemic, where it has made various developed countries as a major challenge. It's a global pandemic. It's not an Indian phenomenon. Second wave again, now things are showing very positive results. The number of deaths has gone down. The number of infections have gone down. The positivity rate has gone down. In certain places, in certain geography, it is there. But the major thing, I mean, while we are addressing this, there is a lot of learning in the last 14, 15 months from the pandemic. The new words to come, how we are going to address that. Suppose if there is a third wave, the second wave, the way it is going, I think it's just a matter of few more days. I mean, it's a matter of few more days and it's gone. The way it came like a cyclone, it will go off like a cyclone. The third wave may come, the fourth wave may come. What is the preparedness and what is that we need to do? How we can manage our cities? There's a lot of learning across the globe, and this is an international conference. We need to share all that. And this is the subject matter of your conference. I think one major learning, which is this platform. I mean, this provides this you is connected across the globe. I mean, this is people from all parts of the world, all parts of the country are connected and talking to each other as if we are sitting in a conference room. In a normal time, this would have been there, maybe sitting in, say, conference hall in Kolkata or maybe in Delhi or some other place, and there are thousands of people sitting there having some smaller group chats, smaller group discussions, and coming out with some recommendations, and we come out with some policies, some execution, some various kinds of things. But here, this platform provides a very robust platform where we are able to interact with each other, learn from each other, and see what is that we can do. It's a very important learning. This digital platform is a very important learning. And what is that we can do so that this becomes a major tool in the city governance? Because the question, specific question which are addressing is a city management under the COVID-19 kind of a situation. It is not only COVID-19, could be anything else. This COVID-19 comes as one of the centuries big pandemic. I mean, there have been some other such kind of virus have been there in past, say 10 years back, 15 years back, but this is a major phenomenon. So what are the learnings and what is that we can do? Now, first let's understand what is that the city do. Because city is a place where the people, large number of people congregate. The density goes high because there is it's like we take the advantage of people coming together, different skills coming together, larger economic, I mean, we call them the engines of economic growth. We call the cities as engine of economic growth because large number of people with a different kind of capacity, different kind of skills, they come together and they kind of synergize to improve the economic activities, whether it is the manufacturing or whether it is the financial activities, whether various kinds of activities, they are all, I mean, they work on the human skills. But at the same time, when there is a larger density, when a pandemic came, which are the places which are hit most? The cities were hit most. Which cities were hit most? The larger cities, the cities like Bombay, the cities like Ahmedabad, city like Bangalore, they were hit most. Then came the second rank of cities like Ranchi, Lucknow, Kanpur. I mean, the second rank of the cities, they started getting hit. And then come the smaller cities. I mean, because cities, there is a higher density and the chances of infection going further, it increases. So in fact, I was very much happy. I mean, mostly last week, I was holding a joint working group meeting with the Federal Republic of Germany, and my counterpart in the German government, the state secretary of the ministry which looks after the housing and urban there. when we were discussing in the joint working group meeting, she mentioned that they have recently launched a challenge for a corona, the cities which will be proof to this kind of a pandemic. How to develop a new city which will be, which will not have that kind of challenges which you face right now. Maybe something new may come, and I have requested her that whatever may be the impact, the result of the challenge, they should share with us. We can have learning, we can have do something of that kind, but that is for the new city. But what about the existing cities? That is, the existing cities, the challenges with the city management is, one is the sanitation. That's a major challenge. When the pandemic hit in the March 2019, one of the first advisories which my ministry issued, that was on the sanitation. What is that we need to do? And thanks to the Swachh Bharat Mission, which was launched by our visionary Prime Minister in the 2014, 2nd October 2014. If the Swachh Bharat Mission were not there, possibly there would be much more other diseases coming out of this pandemic. Because of Swachh Bharat Mission, the cities were much more cleaner. All of you can be the testimony to this. Our cities, the level of cleanness, the city of open defecation free, the defecation on the streets, that has really gone down. That has been controlled a great deal. So that was a good thing. But the sanitation was a major challenge, and we issued a guidelines. There was a confidence among our Karmis, the frontline workers who are responsible for the sanitation. What is that we can do so that they get a confidence and the sanitation can become much better? Because every day we create all kinds of waste, and those waste needs to be taken up, need to be treated. We also need to change our habits, how to reduce the waste, how we can improve our lifestyle so that we can reduce, recycle, and reuse such kind of things. Various things are needed, and there have been large amount of learning to the Swachh Bharat Mission, thanks to the visionary launch of the Swachh Bharat Mission by the Honorable Prime Minister in the 2014. We had that very positive work behind this when the pandemic was started in March 2020. The second thing is the water. Water is a major challenge, and waterborne disease, a lot of things. And in the infrastructure front, we had an Amrut scheme, through which, you will be happy to know that under the Amrut, which was launched in June 2015, so far we have already provided 1.05 crore water tap connections. Now these water connections is one thing. We have provided water to the families. We have to take it beyond. I'll come to that later. Then the sanitation of the wastewater, because all that fecal sludge we are collecting, all the almost like 72 lakhs new toilets were constructed, individual toilets or the public toilets or the community toilets across the all the cities. Now this is the kind of somebody who was defecating outside, they have now started defecating inside the home or inside the community or in the public facilities. Now all these things, unless they are taken away and they're treated properly, that will lead to, it's like a delayed the impact of this. So what is that you can do for that? The fourth component which comes is the transport. Transport is a major challenge. Once you see the cities become very clean, neat and clean. Once the pandemic was there, we were able to clean the streets, and even the sky started looking much bluish. The air pollution came down in various cities. But then once the city comes back, that's a lockdown situation cannot remain always. We have to come back to the normal. We have to have the normal activities. The life has to go on. The economic activities has to go on. So then, what is that? How we can address the issue of transport? We issued a very an advisory on the transport front also. I'll come to that later. Then this is the street lights. That's another area which the cities have to manage, the street lights. The cities have also to manage the various kinds of services to the people. Now, how the cities can do that? Let me start with the transport. The transport advisory which is sent, and which we have, you will be surprised that we had a challenge launched immediately after this, when the lockdowns were over in the month of, I think it's September, October, we launched a cycle for change. We have lost cycling across the country. The cycle had become like a poor man's cycle. But thanks to the Smart City Mission, which has brought back that cycling into the forefront. Now in a lot of the smart cities, you see there is a cycle sharing system. There is a cycle lanes. There are cycle pathways. And then we launch this challenge to all our cities, which are the smart cities or whose population is more than 500,000. That through that challenge process, we will handhold, we will some fund, we'll give some award, and then there's a whole countrywide, there's a lot of interest shown in the cycle for change. We launch another challenge, streets for people. I mean, unfortunately, the streets of the roads which are basically meant for the people. The streets are meant for the people. They have been occupied by the vehicles, by the automobiles. I mean, whether it is a two-wheeler, a three-wheeler, or a four-wheeler, they will occupy most of the places. The people who are walking on the streets, they have no place to walk. They feel unsafe. Their life is at risk. There are a lot of accidents there when they cross the road. So then we launch a challenge called the Streets for the People. Let that people have that prime place there, and there has been a lot of interest shown. I mean, I'll invite you. You can go to our smart city mission and see the kind of interest, the kind of activities our cities have done. A lot of innovations, a lot of creative ideas have come, and we are going to push them through. The third thing, the third challenge we had is the safe neighborhood challenge. How to make your neighborhood safe for the children, for the women, for the those who are differentially able. How to make them safe on the streets. How to make them safe in the neighborhood. So that's another challenge with the cities have to think. And then comes the transport for all, which was launched recently. How we can use the power of IT. How we can connect things. I mean, through the app system. This is how the one mode, there's a multi-mode going in the city, like city of Kolkata will have, whether it is a three-wheeler or a four-wheeler or a metro system or a suburban rail or the rail system, all these things, can you connect to the app? Can there, they can be seamlessly connected through for the payment of fare and all that. We have a national common mobility card system, which has the country has launched. Is something very new, and it is now gaining momentum across the country. So what is that you can do? How we can use the power of IT in improving this? And lastly, how we can improve the public transport. That is the bus system, the BRTS system, the metro system, or maybe even the shared mobility, where the people share the vehicle and reduce the pollution in the atmosphere, pollution to the environment. So all these have been, how the cities can manage the transport, that can make a city a better city. And through this tool of IT, they can do that. The learning from our smart city mission is, we already have the 55 integrated command and control centers. 55, out of the 100 smart cities, already 55 cities have the integrated command and control system. This is like a brain and the nervous system. I coined that word in one of the conference. I said this is like a brain and nervous system of the human being. The cities are like organic bodies, and this organic body has a brain and it has got the nervous system. It can sense, it can treat, it can analyze, it can take decisions. So this integrated command and control center, whether it is sanitation, whether the bins are being cleaned or not, being emptied or not, they're moved or not, they're treated or not, whether people who are supposed to be cleaning the streets, they are doing that job or not. All these things can be collated, organized, the attendance can be done, all these things through the IT system, and this is being done in our smart city. Similarly, whether it is the water, all that water, you have the water, but you can provide 24/7 water supply. The whole fundamental of the smart city is, it is more from less. And how you can get more from less? If you ensure that the losses are less, the wastages are less, and every drop of water is used properly. And that is possible through the SCADA system. That is possible through our dashboard, when you are able to collate and you can track the water from the source to the place which is being consumed, and from there to the treatment, and treatment to the reuse. All these things can be tracked, and this is possible. This is being done in our smart cities. That's another learning. This dashboard can be used for complete e-governance. The people, whether you get a water connection, sewer connection, you get, you get your certificate, you get your building permissions, you get your all the services which the cities have to give. The complete e-governance can be done through that. And the most important, you can reach out to the public. You can, whether it is the information, you want to pass the information to the public in a pandemic like this, or whether it is in communication, two-way communication between through the app system from the citizen to the city managers, how they can be connected together. This dashboard has really provided a very important forum, and that is how through this integrated command and control center, I have requested BEL, one of our leading public sector undertaking under the Ministry of Defense, BEL, we have requested that can we have a prototype of this ICC, because the cities have invested. When the Honorable Prime Minister, he has the vision of getting 100 cities as the smart cities. They are like the lighthouses. They are the places where we are learning, and the things which we have learned, can we translate it back to the other cities? Can we take it to the other cities? Yes. Initially we had to invest a lot, but that was our learning phase. Can we take the experience of these 100 cities to all our 4,372 cities? Yes, it is possible. It is very much possible. And that is how I have tasked BEL, Bharat Electronics Limited, say 3-4 months back. Can they come out with a module of this ICC, which we can pass on to the smaller cities, and with a much lesser investment, using the cloud system, they can have the same kind of power which our smart cities are having. They can do that. And they are, already for that, our BEL, they are trying to do that, this ICC, ICCC in their own colony. The BEL has got a big colony. Considering that as a city, the MD and the whole team was there. I had a long discussion. We had been, my mission director of smart city is following that. So they are going to come up with the module that suppose this is to be given to the city of Bardhaman. Can Bardhaman use this ICCC with very little cost, and using the cloud system today? In these days, this IT thing is not very costly. You can use that and then provide your citizens a better economic, ease of living. This so whether it is the sanitation, whether it is water, whether it is the transport, whether it is the wastewater, street lights, all these things, and even the e-governance, that is the which touches the life of every people. This can be done through this kind of a system, IT-based system. In fact, we have in the ministry, we have been trying to get this e-governance system 100%. All our cities can be, on the e-governance platform, and that's our learning. That's a COVID-19 learning. That we have to more and more, we have to suppose the construction permit. For that, you have to go from one place to another place. Different seats, you have to change your application. I'm very happy to share with you that the work with the ministry has done. Our rank was 186 in just 2015. Today in 2020, the last World Bank report, ease of doing business, our rank was 27. We jumped 159 places in just 5 years. That is the kind of reforms we have introduced in Delhi and Bombay, and that reform has gone to 2,308 cities. Now that has to be replicated across the globe. All the cities has to follow this kind of model, that e-governance, where the people don't have to go from desk to desk, people don't have to chase, people has to just be through this this IT platform. You can enter your application, you can enter your thing on the dashboard or on the platform of the city, and there you can get an answer, you can get the service. That is the kind of thing which the city managers have to introduce to bring ease in living. Two more things which I would like to add in this context. The one area which is very bothersome during this pandemic is our street vendors. Street vendors are, they're very important to our economy. They provide a kind of a support system which normal economy, the formal economy does not provide. When it is getting vegetables in your colonies or in your house, or getting the fruits, or getting the, say, various kinds of the daily utilities, or whether it is the laundry service, say for example your hair cutting, all kinds of things which is the services at home is provided by the vendors. Unfortunately, this was one community which was never touched in the last 7 decades after independence. For the first time during pandemic, we had the PM Swanidhi scheme, Pradhan Mantri Street Vendor Atmanirbhar Nidhi scheme, and I'm very happy to share with you, in just last 9 months, the scheme has done wonders. More than 41 lakhs people have got registered for the loan on this scheme. More than 24 lakhs people have got their application sanctioned, and almost like 20.5 lakhs people, more than 20.5 lakhs people have been granted 2050 crores of loans. So their business was totally gone after this pandemic. In fact, there have been a lot of learning from this pandemic, that we came to know that they were taking loan at the rate of 500%, 400%, 100%. That's the kind of interest they were paying, but now they were getting out of it. Unfortunately, there has been a second wave. There is a shock there. We were thinking, what is that we can do to provide them the relief? And the second aspect which bothered us during the pandemic was these people who are, normally live in, say, slums, or say informal settlements, is a huge dense population, and that's a phenomenon not in capital city, but in all cities across the country, bigger cities, smaller cities, in some form or other form. There is an unauthorized living, there is a living in the slum areas, or the living in the informal areas, and there the services are compromised. So what is that we can do so that people have a decent living? Because somebody comes from a rural area, say a student comes from the rural area to study in a city, to have a better education, or to have better health facilities, or to have a better entertainment or leisure or such other things to improve his quality of life. He is not coming here to feel the challenges. But unfortunately, the living is, getting the rental housing at a cost becomes so costly, so difficult, that he has to settle in such informal settlement or in a slum or such other areas. So then we started a scheme during the pandemic. That scheme is the affordable rental housing complexes scheme. And to share with you, this is doing so wonders. Affordable rental housing complexes scheme is basically using already constructed houses which are not occupied, or allowing certain kind of incentive to the private sector and the public sector to use the space which is available. If the space is available, we only incentivize them to use that for creating such kind of a hostels, such kind of a facilities where people who are students, maybe urban poor, urban migrant, they can live an honorable, decent, dignified living and earn their living, and also contribute positively towards the economy. So this rental housing, or the social rental housing, could be another thing which has to be addressed. In fact, these things has to be part of our urban planning. A lot of urban planners must be there in your this webinar. In fact, I would like to note them. Let them think, try to see what is that we can. Why do the slums come? Why people have to compromise on the living? Why do such kind of informal things are coming? Now we are thinking of the new urban India. We are thinking of the new India. We are thinking of the developed India. Can we have a slumless city development? Can we have the cities which are more properly planned development? There's a lot of learning from the Smart City Mission. In fact, 3 months back, in the month of January, we launched a document. In fact, I will invite you to go through our document, learning from the Smart City Mission. We would like all cities, making cities smart, learning from the Smart City Mission. So whatever is the learning from these 100 smart cities in different forms, can those learnings be translated into the experience of all other cities, and they can become better city managers? Ultimately, the objective of, there is a very important saying by Ian Gale, a very renowned urban planner from the Denmark. I had a privilege of meeting with him when I was visiting that city. I went and spent more than an hour, and he presented me a book written by him. He has written plenty of books, and there he says cities are for the people. Cities are not for the mayors. Cities are not for the city managers. Cities are for the people. The cities have to manage the citizens' life in a way so that it brings ease in their life. It reduces their challenges so that the citizens are able to realize all their dreams. Where people come with aspirations, dreams, various kinds of things which they would like to do for their children, which they would like to do for the city, which they would like to do for their country, they would like to do for the state. So can that become that what the pursuits which they want to do as a writer, as a administrator, as a business person, as a artist, any kinds of profession they profess, that profession, they do not have to face the challenges of living. Rather, they face the challenges of doing their best and contributing, realizing their potential. And that's what the city's managers, that's what the city's, those who are responsible to manage the city, they are supposed to do. A smart city is the one where the managers become smart and they look after the citizens well. That is the major focus. And learning from this COVID-19 is that we have to, all that infrastructure we have got, we have to keep on building our infrastructure. We have to keep on building the road, electricity, all these things we have to do that, but have a layer of the IT also, so that you are able to get the best out of that infrastructure which you have created, so that we are able to deliver the best to your citizens. That's the message which I would like to give. There is a challenge, there is a huge opportunity in to invest, huge opportunity to readjust ourselves, huge opportunity to realign ourselves to become closer to our citizens. One example I will give and close here. For example, like the current pandemic, there has been a huge challenge in the hospital. I mean, whether it is oxygen supply, or whether it is the hospital beds, or whether it is various kinds of facilities in the hospital. Can that kind of a management, can that management, the city can help these hospitals through this kind of a smart dashboard kind of a system, that all the movement, availability of the bed, availability of the ventilators, availability of the ICU facilities, availability of the various kind of other medical infrastructure, that could be readily made available to the people. Can that information gap be filled in? Can the communication be very straight and clean? If I want to, if I have facing the challenge, can that challenge be addressed? Can that, suppose if I need, I mean, people are confused whether I need to go to the ICU or whether I can have the home treatment. Can the our citizens be counseled through a two-way communication using this ICCC? Yes, it is all possible. It has been done. It has been done by our city like Indore. It has been done by city like Surat, city like Varanasi, Agra, various cities. I mean, across the country, various smart cities have done so, and all other cities can also do that. So we must, I mean, learning from here is, well, it looks challenging, but it is possible. And the country has learned in the last 6 years that everything is, we just have to realign ourselves, we have to readjust ourselves, we have to improve our working, we have to take this kind of a position, and then we can serve our citizens better. So I wish you all the very best for this 2 days detailed engagement on this very important subject of the COVID-19 and the city management, challenges and opportunities. I hope there will be a lot of learning from here. I'll be very happy if your institute can share those things to the ministry, which we can deliberate further, and whatever best can come out of it, we can share with our other cities. Thank you for giving me this opportunity to talk to this August gathering on the digital platform. Thank you.
Thank you, Mr. Durga Shankar Mishra sir. Now it is time for interactive session. The participants, you may post forward your question to sir. Is there any question from any participant? Okay, I think there is no question. So now it is time for the next special lecture on changing role of urban governance and city dwellers by our guest of honor, Mr. Debashish Sen, the Chairman Managing Director, HITCO, the Government of West Bengal. Sri Debashish Sen joined the IAS in 1985. He graduated from Presidency College, Kolkata, and got his post-MSc diploma from Shaha Institute of Nuclear Physics. He got his diploma in public administration from ENA, France, and he has been trained in the JFK School, Harvard University, and IMF Institute, USA. Mr. Sen has served in various capacity, including the district magistrate for more than 5 years, chief electoral officer for 5 years, and head of information technology camp electronics department for 3 years. He is presently posted as chairman Managing Director HITCO, which is a government company and that is developing the smart city of New Town, Kolkata. He is also the chairman of Navodiganto Industrial Township Authority at Sector 5, Solle, Kolkata. So now I invite Mr. Devashish Sen to give his valuable lecture.
Good afternoon, everybody. Am I audible?
Yes.
Okay, thank you. So, good afternoon, everybody. Thank you very much for having me. I listened to the keynote address of Dr. Mishra, and he has been very comprehensive, covering all aspects of urban management and in the light of the COVID. I will, however, take some of his thoughts further down as I see it from as a practicing manager. You know, as chairman of NKDA, it is like being a mayor of a city and handling everything that relates to the pandemic and to stick to the topic of using citizen resources to further combat the menace that we see in this second wave of pandemic. Those of you who are from Bengal would know that the state government has declared today afternoon at around 1 o'clock, a 15-day lockdown period for the whole state. And so it is war again, a war on the COVID for the second wave. And talking about war, one of the main ways in which urban governance is with so many things that we are supposed to do, starting from sanitization, starting from cremation, starting from oxygen parlors, starting from spraying, starting from confinement, starting from maintaining safe distances, creating awareness and minding people, starting from sanitizing markets, starting from giving free food to elderly citizens who are COVID affected, starting from creating oxygen parlors, everything we have to do. And to tackle all these paraphernalia, what we have done and created what we call is a war room. It is nothing short of a war. And if those of you who are from Kolkata, if you see today's Bortoman is a well-known circulated daily from Kolkata, and today's Bortoman talks about the war room strategy of dealing with the pandemic from the point of view of an urban local body like NKDA. And what it essentially highlights and what we do every day, even before this lockdown was declared today, we started it well back in the 1st of May on the top of the second wave of the pandemic. And what we do is that basically we form cells for each of these activities with an officer in charge, and we meet, including I chair that meeting with everybody precisely at 2 p.m. every day to see what has happened in the past 24 hours, take stock of the deaths, take stock of the new victims, take stock of the food position, take stock of everything that's happening around, and plan for the next day. This is a strategy that war generals do normally, and we are doing this because indeed we think it's a war. So this is a method of the multifarious things that are happening. As I said, finding a hospital bed, finding a doctor, finding blood, finding oxygen, setting up safe homes, to cremation, finding domes, finding hearse vans, finding ambulance, creating ambulance. It's a maddening place, believe me. So one way to bring sanity is to have a systematic procedure in a war-like situation. That is exactly what we are doing, and with a no small degree of success. The other thing, and in this case, in this regard, I must mention that we are having vaccination centers. We are running vaccination centers as many other municipalities do. And while there is a scramble all over, nobody knows how many vaccines are available. People start queuing from 4 a.m. in the morning, and they're old and young. They are all queuing up, and suddenly there is a declaration and a notice that no more vaccines, all finished, and everybody goes back very, very disappointed. We have not allowed this to happen. Only place perhaps in Bengal or India where there is no rush at the vaccination center. And what we do is that we have multiple channels of pre-registering. Not only the COVID portal, which does not is not very effective out here because only second doses of vaccination is now allowed, but also there is a request registration, there is a WhatsApp registration, there is a 24/7 call center registration, and individually we call everybody. Usually it is 400 to 500 people each day. We call everybody that tomorrow, depending on the vaccine availability and the requests and those who qualify, right now it is only 45 plus second dose that are getting the vaccine, and each of these 500 400 people are given a call in the evening. Why evening? Because the vaccine availability for the next day is known only in the evening, and we know what are the requests pending, so we prioritize. Priority is according to those whose date of expiry of the second dose is expiring. Earlier it used to be 6 to 8 weeks. From today, it has been 12 weeks. So again, there is a bit of a re-gearing of the strategy, but I'm talking about till yesterday. So each of these 400, 500 people, depending on vaccine availability, would be called in course of the evening so that they come with a confirmed appointment the next day. No chaos, no nothing. Anybody who reports gets a token, and in order of appearance, he is called gently, sitting in an air-conditioned place, absolutely flawless. So how we emerged at this model was by repeated interaction with people who are there, people who are actually taking the vaccines, and trying to figure out strategy, making it more and more friendly in the war room. And what we did was, one of the factors we noticed was not everybody was very comfortable in the IT. Newtown is the only smart city of Bengal, one of the 100 cities that Dr. Bistro talked about of India. And however smart we are, we know many people, elderly citizens, and also people from the lower portion of the socioeconomic status are not very conversant in using such apps and web for portals. So what we did, we called for volunteers. We called for volunteers from among people who are there in the new town. And so many volunteers have come forward, and we put their names in the website and also in the call center, because if somebody can know the website, find out to whom to ask for help, perhaps they also know how to fill up the COVID portal. So what we did is that call center number 24/7 helpline, as we call it, the 24/7 helpline of Newtown, they are given this volunteers list, and anybody can have a one-to-one telephonic conversation to have his or her name recorded. So one other strategy, rather than the number one war room, the other number two is fine-tuning a process that is very smooth and convenient for everybody in gradual steps. And the third is getting citizens to help other citizens, getting citizen volunteers to help other senior citizens and transport workers and other things. This has been a very, very good strategy for us, even during the last lockdown in the last 2020 pandemic situation. We had formed several neighborhood network of volunteers, and each of them helping each of others, and we were able to mobilize them very, very effectively. And when Dr. Mishra talked about ease of doing business, and he has very rightly pointed out that India's position has grown from 127 to 25, a very, very creditable achievement, I must say. So I in my previous posting as IT Secretary of the State, I was associated as a coordinator of the UODB, and I used this strategy in city governance. I used it last year to make a competition among the different gated communities of Newtown was one part, and the blocks, that is the housing welfare associations and the others. We created a competition on the lines of UODB as to certain parameters: solid waste management, COVID management, Durga Puja, COVID friendliness, green processes with clear marks, guidelines, and how the marks are awarded. And a training session also for the people of the housing society. And there was a huge competition. We gave them sufficient time. We did mentoring, and on the 1st of April of this year, we announced the results. In fact, 31st of March, we announced the results and said the gated community of Uniworld was the first. And when they got the first, the other blocks started saying, why aren't we first? Why aren't we? Like, mind you, like the EODB thing, there's not a single prize, and the token prize was given. There's not only how you are doing good citizen behavior, what you can do. You can do not throw plastics on the road. You can segregate solid waste management. You can maintain COVID protocol by using mask and maintaining distances. You can stop wasting water. You can plant a tree. All of these were noted down and points were given and evidence was to be given, and so that this competition ranking of the different blocks and gated communities among the people has created an extremely good synergy, positive synergy for this pandemic control as well. And other than the volunteers and the ranking and the other things, we have also enabled enough enthusiasm among the people of the gated communities and the housing blocks of Newtown, so that they are coming forward, as in many other places. I'm not saying this is the only place, of using their community hall, of using their clubhouses as a safe house with oxygen beds, because we all know, so it's no point saying because. So, but within their community, they're adding extra COVID treatment beds. And I think it's a fantastic thing. We are guiding them. Our doctor is going there and they're saying, this is the way to do it. This is the way to don on a PPE. This is how you off don a non-PPE while you go out. This is the way to throw. This is the way to manage. And we are having right now, as I speak, 20 beds, safe house beds run by NKDA, 10 oxygen parlor camps run by NKDA, but many more. My guess is at least 50 or 60 in the private sector, within the community. The resident welfare associations themselves have come up, and we have been able to synergize so that they come up and help us all and themselves in finding out that this is a safe place for COVID patients who are yet to be hospitalized or yet to get a bed. We are also talking of a certain number of new things that are coming in. Dr. Mishra talked about waste management and other things, of not throwing these things. In the pandemic times, we all use masks. The surgical blue masks, as we all say, are use and throw. You can use them once. But where are you throwing? Where are you throwing? You are probably throwing it in a bucket, in the same garbage dump that it is going, and it is highly unrecommended, not recommended. So we are creating a synergy. We have put yellow bins and we are reaching out to the people. And this is probably my last point of involving citizens in the management of COVID, in addition to whatever I've said, is that in Smart City Newtown, we have created a Newtown radio, a radio station professionally managed by professionals, but a radio station that does not use frequency modulation, FM radio or AM, of course, nobody uses these days, but it's an internet radio. You go to Google Play Store and you search for Radio Newtown and you will get that apps and download, and there is a regular broadcast. And for involving the citizens, we are using local talent, boys and girls, students, etc., who can sing, who can dance, and it is recorded in the Radio Newtown studio and it is broadcast. And it starts with the performers, the families and their friends listening to the performances, seeing the performances also on Facebook. And gradually it is gaining a very, very wide viewership within the city, of course. And that is precisely the point. If you want to communicate that from tomorrow, the gap between first and second dose for Covishield has increased from 6 weeks to 12 weeks. How do you do that? How do you do that? Can you give SMS to everybody in the whole city? Can you do that through WhatsApp in the entire city? Can you do that through merely miking? Miking is a good way, but it's very difficult to reach everybody. So we are using technology, Radio Newtown, apps radio, making it popular beforehand by use of cultural events, and now using it every day at 6 o'clock for 15 minutes, the latest information about COVID, where are the beds, where are the oxygen, and where is the immunization centers, and what are the private sector options, what are the government options, and every bulletin that comes in through the government sources, we are trying to put it up there so that if anybody needs it at the time of need, all he has to do is to tune in to Radio Newtown. All said, I will say that for government alone, for the health sector alone, for the municipalities and ULBs like NKDA alone, it is jolly well impossible to fight a global pandemic like what we are seeing. We have to involve the citizens. And citizens are volunteering like anything. They are coming forward and helping us and supporting us, and we are guiding them. I tell you, ladies and gentlemen, that this is a great way of jointly fighting the war, and we are doing that in a very, very systematic manner. Thank you.
Thank you, Mr. Devashish Sen. Now, any participant has any question?
Okay.
I mean, there is no question from any participants. Okay, so thank you, Mr. Devashish Sen, sir, for your wonderful discussion. Thank you.
Arindam, you may call Ajit Pai, sir. Sir is there also. Sir, thank you for joining with us. Am I audible, sir? No.
You're audible. Delighted to be here.
Thank you, sir. Thank you.
Yes, now our next special lecture on the economic policy revival in city planning by our guest of honor, Mr. Ajit Pai.
Arindam.
Yeah.
Arindam.
Yes.
Sir, lecture topic has changed. It will be urban renewal to revive national growth.
Okay.
I have already shared. Have you shared the PPT? Have you find out the PPT which I have shared? Okay, please. Please continue.
Okay. By our guest of honor, Mr. Ajit Pai, the distinguished expert and head of economics and finance, Niti Aayog, Government of India. Ajit Pai is distinguished expert of Niti Aayog, where he heads economics and finance and oversees public disinvestment, and he is also the consultant to the vice chairperson of Niti Aayog, is the nodal officer for the Ministry of Finance and its subsidiary department and the Department of Public Enterprises, and handles matter related to the World Bank, IFC, IMF, ADB, NDB, OECD, and the G20. Mr. Pai is also the chairman of Delhi Urban Art Commission, a statutory body created by an act of parliament in 1973 to advise the Government of India in the matter of presenting, developing, and maintaining the aesthetic quality of urban and environmental design. So, he has been awarded over 6 years an unprecedented 5-1 and 1-2 the Stermine Awards in the Forbes and Financial Times World Best Analysis Survey for forecast accuracy. Mr. Pai holds a Bachelor of Arts from the School of Planning and Architecture, New Delhi, and Master of Arts from the Yale School of Architecture and MBA from the Yale School of Management. He attended Yale University as Tata Scholar and also served as a John M. Olin Fellow for Research in Markets and Regulatory Behavior. His active interests include architecture, design, the anthropology, urbanism, planning, history, economic development, sustainability, horticulture, finance, technology, travel, real estate, art, policy development, and governance. He is one the executive committee of the Indian Policy Foundation on the advisory board of the Future Institute and is registered with the Council of Architecture. So we are extremely happy to have him with us today. And so I invite Mr. Ajit Paiser to deliver his today's speech. And I am also handing over the responsibility of conducting this program to Ms. Antara Kundu, the Executive SAIARD. So, Mr. Ajit Pai, sir, over to you.
Thank you, Arindam, for that wonderful introduction. And also thank you, Dr. Chaudhary, for inviting me to speak at this forum. So what I will sort of focus on right now is, I think all of us have recognized after hearing the last two speakers that COVID-19 in urbanism is both a question of lives and also a question of livelihoods. And I think the prior two speakers have focused on both of those areas. They've been fairly well balanced in looking at both, all that can happen in our cities to deal with COVID-19 on a direct basis. What I would like to use this next 20 minutes for is actually to focus on only one of those two, which is less to do with the lives and more to do with the livelihoods. And as a Center for Urban and Built Environment, I can tell you that the potential for doing what COVID has created as an opportunity right now for an urban renewal is greater than in recent history. And why is that so? People will say it is multifold. I think the first thing that we see in this pandemic is that it reduces economic activity. It has drastically reduced our economic activity in the June quarter of 2020, where there was a 24.4% decline in the GDP of India in one single quarter at the pace relative to the prior quarter. Of course, once that lockdown was lifted, economic activity accelerated. And by the time we reached the December quarter, we were already at par with the prior year. We are moving into the growth arena. But again, as we are seeing the second wave right now, we are seeing lockdowns around the country and beginning things to slow down. Wherever there is lockdown, there is reduced human activity and there is a lockdown. Now, as you can imagine, this creates huge challenges for a country where the per capita GDP is still only, less than 20% of world average. And I think, both Secretary Mishra as well as Dr. Sen have pointed out what the human cost is, whether they have talked about the vendor on the street, whether they have talked about the migrant labor, when they talk about the other issues, you can see that livelihoods have been hugely impacted. So what has the government of India done, and what is the approach that we have taken at the central level to deal with this? Can a country like India, which already has very high debt to GDP, start giving what they call money? Would it be helpful to give money to the lowest? While we have given food from the public distribution system, while we have given some help financially, is this sustainable? Do we know how long the pandemic will last? And what we really need to do is actually get the engine of the country and economy going so that whatever we give to help the people that are displaced and impacted can actually be more sustainable. The pandemic has already lasted for longer than a year. and it could last a lot longer. People are talking about after the second wave, potentially a third wave. While I don't want to say whether a third wave will happen or not, what we do know is that the economic cost has been much greater, and the increase in our public debt has increased very substantially, and the human cost is also very substantial. So one of the things that actually the government of India and the central government has pushed during this pandemic, and I think is a strategy for CUBE to help with, the Center for Urban and Built Environment, is that to create livelihoods in areas which are not impacted so much by the pandemic. And that there are two areas which create a lot of employment, and that is both infrastructure and construction. As many of you will know, the amount of employment created by infrastructure and by construction for every rupee spent is 5 times more for the same money spent than the average of the overall economy. So rather than money going into different areas, going into trying to boost a little bit of consumption here and there, we can create a far greater employment and improve our country, improve our infrastructure, make ourselves more competitive, whether we're investing in logistics, whether we're investing in roadways, whether you're investing in the railways, in railway stations, in airports, in water supply, in sewage, in overall urban renewal, which is much needed in India. I'm sure all of you will agree. If that money, instead of going into other things, goes into these areas, it'll make that ease of doing business, where we have increased the rank significantly, ease of what I would call ease of living, in addition to the ease of doing business. Those two factors where we still don't do very well outside of the Delhi and Bombay, where the, of course, ranking is focused, we can actually improve as a country vastly, make ourselves far more competitive in global trade, and in the short run, improve the economy. You'll also see that a lot of the infrastructure projects and a lot of the building projects, construction projects that we have are in open areas where the virus is more difficult to travel and transmit. And also, if they're done by larger, well-organized players, and the focus is there, that are given licenses, then it can continue with all the precautions, whether it's measuring temperature, whether it's even the most basic testing, maybe the RAT, if not the RT-PCR everywhere, but anywhere where we can actually maintain controls to ensure that the pandemic is not supported by infection spreading. If we can invest in those areas, then we can keep economic activity going. We can create a lot of employment, which will reduce the load, not just on our Manrega system and the rural employment scheme, but in urban areas. So this is one of the things that I wanted to reach out to the Center for Urban and Built Environment, as well as all the panelists here, to think of ways and means that we can figure out how to get this all going. How do we get a whole in urban renewal? How can we get this to happen, whether it's infrastructure, whether it's construction, to improve our housing stock, to improve our office stock, to improve our factory stock, to improve our roads, improve our sewage, everything at a time when the country needs that activity more than ever before, and at a time when it is least disruptive to the country. Everyone complains that in full traffic moving on the road, how they're digging up the road once, digging it up again, digging it up a third time, creating congestion, creating issues, whether it's pollution. At a time when there's the lowest traffic on the road for a long time, when there's the least congestion, least movement, can we think about pushing these projects forward? Well, the national government can do so much. There are 3 tiers of government. There's the central government, there's the state government, and eventually there's also the third tier, which is both the PRIs, the Panchayati Raj institutions, and most importantly, the ULBs, which is the urban local bodies. And the urban local bodies, while the funding, the majority of it is going to come from the state governments, but these are the ones that are actually going to be able to drive this the greatest. If you look at what happened when the government talked about at the end of 2019 about what they call the National Infrastructure Pipeline, we're looking at 111 lakh crores of money that is going into that pipeline. For the first time for this country, we had a view that was not just a central government view. It was not just a view proposed by the Department of Economic Affairs that this is what 111 lakh crores would be spent by the central government. It was a view that 40% will come from the central government, 40% will come from the state government, and 20% will come from the private sector. Now that 20% is a huge number considering what has been spent before, but that is a beginning. And by that, we start talking about something called the PPP, the public-private partnership. And over the next couple of years, just because of the amount of government resources, both at the center level and at the state level, that is going into dealing directly with the pandemic, going into directly dealing with the poorest segments of society that need that support, going into so many things that have resulted from this interruption in business, I would say that that is where our focus, a lot of our thinking has to go on how we can work most effectively by including the public and ensuring that this whole urban renewal is a public-private partnership. And how do we ensure that the state provides unprecedented level of support in terms of ease of permitting, in terms of land use, in terms of support to make this happen as quickly as possible, so that there can be money from the private sector that is deployed as quickly as possible, and that livelihoods are created in an area where the greatest number of jobs can be created for the limited resources of a country that is still not a wealthy country, even though it is now one of the largest economies in the world. So that is the challenge that I think we face, that I'm throwing out there to CUBE to think about this. Now I'll be addressing one specific challenge that has been talked about by both of the prior speakers. I think Secretary Mishra spent more time talking about it, a little bit more than Dr. Sen. But this is the challenge of what we would call some people call it the informal development, some people call it the unauthorized development, and some people call it slums. But I think all our major cities have a problem with unplanned development that has taken place. The estimates for Delhi are as high as in the very high 40% of our population stays in this sort of unplanned development that over time gets regularized. But this creates challenges whenever it is land that has been taken over or put to the wrong use, or it's public land that is illegally occupied. It creates planning challenges, because whenever it is unplanned, it also has unplanned consequences. And when we look at these areas, it is occupied by people that are critical to Delhi. It is the people that actually make a lot of everything happen on the ground in Delhi, whether it's in construction, whether it's in cleaning, whether it's the staff, whether it's in Mumbai, whether it's in Calcutta, whether it's in Delhi, whether it's in Bangalore. We are seeing the people that occupy this are critical, and very clearly the unplanned nature of how these things have evolved as part of our cities is generally in areas that are very central for the convenience, but also creates its own issues over there, not just in the spread of disease, I'm not talking about that way, but even in longer term things like hygiene, in water supply, in sanitation, in fire tender movement, in the basic amenities that exist. So it is here that I think that there are many models that exist. In Mumbai and Dharavi, they have looked at some models. In other cities around, they've looked at some models. But over here is where I think the public-private partnership can be revisited. And the models for revisiting this, to actually make this happen, I think that the intellectual bandwidth is there, even within this panel, even within this institute, of minds that can be put to it on how do we make this successful? How do we get the alignment of interests of all the parties over here? Can we look at some of these areas? What is the right size of area to look at? 1 square kilometer, 2 square kilometers, 3 square kilometers, 10,000 habitations, 1,000 habitations. How can we look at this area that has been informally encroached on, that the roads are not wide enough, the sanitation is not sufficient? When we legalize by providing water supply and electricity over here, are we increasing the problem or are we reducing it? Because suddenly now sewage becomes a problem. The Yamuna and the Najafgarh drain in Delhi are flowing with water with no oxygen. Why? Because of untreated sewage going into this. Can we formalize these areas by reclaiming this property, making sure that at a local level, that at the same level in the same neighborhood, that the people that are being displaced can be provided accommodation, that this new development that happens, can we get the builders to do it and give them FSI, increased FSI in this area? Can we reclaim and provide green areas again, but create the community, create the RWAs, create all of that infrastructure in these areas so that people's quality of life improves drastically in these areas, but while deploying private capital, private enterprise, not calling it low-cost housing, not calling it affordable housing, even though that both of these, if they are products, then we will be very happy, but trying to provide 21st century quality housing to the citizens of this country, but using private capital. Give them the FSI. Give the builder enough that if he constructs this thing, because some of these locations are tremendous locations, center of the city, amazing locations, maybe 30% goes to existing residents in terms of, high quality square footage relative to the same ratio of square footage they're occupying now. But instead of the single story or double stories they're occupying of kacha, they actually get full pakka construction, and that becomes legal. Can we do this? Can the cities actually formalize? Can the urban local bodies in India rise up to this challenge? Can we create programs that actually work? Not just displacing these people like slum redevelopment has happened under a flyover for some project and giving them housing somewhere and then they come back there. But can we make this sustainable where these people are? And can we make this a model that if it starts providing huge employment at a time when the country requires it, in projects that are in open air, we'll be doing the country a lot of service. We'd be thinking of livelihoods in addition when we're trying to slow other economic activity. You know that the other economic activity like retail, like theaters, like bazaars, everything is stopping because of the way the pandemic's been. But is this something that we can continue at a stage like this while upgrading our stock and making this country and the cities of this country, far more desirable places to live in? Delhi is likely to become the largest sort of urban agglomeration in the world by the end of this decade. Can we also make it the sort of the most desirable for all its citizens? All the people that live here, the residents, the workers, also the tourists that come here. And can we do that to every city around the country to start making it more attractive and using this opportunity when there's least disruption to people's lives to actually catalyze this and start helping the country by getting this development going? I'll stop over there and happy to engage further on this. Thank you.
Thank you so much, sir, for your wonderful lecture. On behalf of SAIARD, I would like to know one thing, that suppose the institution like us, Center for Urban and Built Environment, as we have already told that we are mostly focusing not only for research and academic purposes, but also for some policy making purposes. Even I have already mentioned that the whatever the outcomes will generate through this webinar and through the version of different participant resource persons lecture, we have a plan to submit this proposal to the Niti Aayog also, as well as Ministry of Urban Affairs and Housing and Urban Affairs also. So is it possible, suppose if we want to work in collaboration with Niti Aayog regarding any urban retrieval or urban planning or policy related issues, so Niti Aayog has any collaborative way or opportunities for us?
Yes, certainly. So thank you for that question. So Niti Aayog has a vertical that is focused on urban matters and urban on the cities of India. And it's headed by an additional secretary, Dr. Rajeshwar Rao. And I would encourage you to reach out to him and the vertical to see how you can work together more actively. So there are verticals, the manner in which Niti Aayog is structured, and there is specialization. But as you can see that when you do economics and finance, then you deal with all the verticals, whether it's transportation, whether it's urban, whether it's rural. So in my role at looking after the economics and finance cell, I deal with it with all of these areas.
Maybe some technical glitch is there. So let's arrange one. Ajit sir, am I audible? Sir, please join once again. Yeah, I think sir has some technical problems, so we should proceed our next speaker. Antara, are you here?
Yes, sir, I'm here.
Okay, okay. So we should proceed our next speaker. So if sir join,
I think sir has joined, sir. Mr. Ajit Pai has joined once again.
sir, am I audible?
Yes, you're
Mr.
audible.
Pai?
I'm sorry, I got
Okay,
knocked
okay.
off over there.
Yeah, no issue. It happened. So, sir, yes, please, you should continue. You may continue, sir.
So I don't know at what point I lost you, but I was mentioning that we have urban.
Yeah, you mentioned the name of Rajeshwar Rao. You
That's
mentioned
right.
the name of Rajeshwar Rao.
Yes.
After that, we can't hear you anymore.
Okay, so Rajeshwar Rao is the additional secretary that is responsible for this area. And while economics and finance goes into all areas, so we do deal with these issues and we are called in at various points of time. We are spread across multiple things at NITI Aayog. In fact, almost all the verticals we'll have some level of interaction with. There's a different vertical for water, for example, and water resources. There's a different vertical for infrastructure, or a different vertical for PPP. So we will be spread as my group that I look at, we are spread ourselves quite thin. But I think for what you're trying to do over here, it'll be best to reach out to Dr. Rao and his vertical, and that also deals very actively with the Ministry of Housing and Urban Affairs. So I think getting that three-way coordination would help you.
Thank you, sir. Thank you so much for your wonderful lecture, and thanks for joining with us. And if anybody have any queries, please may ask. Otherwise, we will go for our next speaker. Okay, so Antara, please continue. Thank you, sir.
Yes, sir. Thank you, Mr. Ajit Pai, for sharing your thoughts, such nice words. It was wonderful having you here. So our next speaker is Ms. Vinita Shetty. She is the Barcelona-based founder and executive editor of the Smart Citizen, a cross-national platform for experience sharing and collaboration on smart nations, cities, regions, and communities. She promotes and advocates smart city strategies through context, rich case studies of real and feasible technologies leveraged through sustainable business models for direct impact on citizens and governance, with a geographic focus on Europe and India. In her current capacity, she has been an advisor and media partner to worldwide affiliates of Pacemaking X in Brooklyn, New York. As an independent consultant based in Geneva, London, and Mumbai, Ms. Vinita has advised a variety of clients in diverse areas involving market discovery, strategic communications, relationship management, event management, and partnership building. Her clients have included well-known institutions like Panasonic Japan, Commonwealth Telecommunication Organization UK, Sinova Switzerland, Patni Computer Systems, and a mobile video startup NUTV India. As an external consultant to Nokia Corporation Finland, Ms. Vinita supported the global public affairs and advocacy activities of a new division focused on emerging markets. During her career, Ms. Vinita has covered some of the monumental changes in public telecommunications in Europe and major developing countries. Her commentary on emerging markets and development issues has always been well received as articulate and authoritative. She will be speaking on the topic of unbilled back better today. Over to you, ma'am.
Thank you so much, Antara. And I am really very privileged to join my voice along with some of the distinguished people that spoke before me. And thank you so much for giving me this opportunity, Biswajit. I will be presenting my own PowerPoint, so if you bear with me. I think I need to give authorization to.
Ma'am, first you may open your PPT over desktop.
Sure, yes. But it asked me for if I want to share the contents of my screen with Meet Google. So how do I enable that?
I don't think it should be required anything. You just first minimize your Google Meet part and open your PPT on your desktop.
Okay, can you see my PPT now?
No, ma'am, no. So
Oh.
just do that as I said.
Yes, but I do have my, okay, I'm minimizing this and I've
Okay,
got
and
my,
open your PPT. Yes.
yes.
And after that, now you come to the Google Meet part
Okay.
and go to the present now.
Yes, I did do that, but
Yes, there
apparently
you may find the a window.
yes, but it
I
says
think there you,
it doesn't give me an option to share because it may have something to do with privacy. So
okay.
I'm so sorry.
But
So,
so can you share your PPT to my mail?
sure, let me do this. Thank you. So,
Just share.
do you want to proceed with another speaker while I do this?
So shall we proceed for another speaker?
Yes, sure, then come back
Okay,
to me.
okay. So Antara, please invite Professor Amit Hajela, sir. After that,
Yes, sir. Sure, sir. Our next speaker is Professor Dr. Amit Hazela, who is an architect and urban designer involved in professional practice, academics, and research since the last 30 years. He is a fellow of the Indian Institute of Architects, fellow founding member of Institute of Urban Designers, India, expert member on Smart Cities program, and jury member for various design competitions and awards. The core area of his work are in the areas of urban design, campus design and planning, institutional buildings for higher education with high-end AV integration, healthcare facility planning, corporate offices, interiors with focus on sustainable design, and green campuses. Some of his notable works include comprehensive master plan and buildings for University of Allahabad, Jamia Hamdard University, New Delhi, LIC Divisional Office Complex, Allahabad, and Center for Performing Arts, Patiala. At present, he is a visiting professor at the School of Planning and Architecture, New Delhi, adjunct professor, Indian Institute of Technology, Roorkee and Director, College of Architecture, Vastukala Academy, GGS Indraprastha University, New Delhi, having made significant contribution to the undergraduate, graduate, and doctoral programs as an external expert and Board of Studies member. He has several publications at national and international level to his credit, besides having delivered keynote lectures at national forums. He'll be speaking on the topic of healthcare infrastructure and disaster resilience today. Over to you, sir.
Good afternoon. Can you hear me?
Yes, sir, we can hear you.
Yes, sir.
Okay.
Yes.
So thank you very much for having me here today. And it's a pleasure to be part of this event, which is a very relevant subject of discussion. And we had some wonderful thoughts from the previous speakers, and probably the areas of our concern, which probably we need to deliberate very intensely in view of the complexities that we deal with on an everyday basis. And those challenges need to be addressed and handled from a very, very humane angle. So if you permit me, I would like to share my presentation, and I'll open my presentation now. Is it visible?
No, sir.
Okay.
Yeah, it's coming, sir.
Coming to?
Yes, yes. Thank you.
Okay. So can you see it? Is this visible to everyone?
Yes, sir.
Yes,
It's
sir.
visible.
Right. Okay. So thank you. So I'll go ahead. Um I think cities and public health uh, are very, very critical to the well-being of the people. And good health actually is a state of physical and mental well-being necessary to live a meaningful life. Health is an important indicator of human development, and healthy individual is an asset to himself and the economic progress of the country. So good health for all should be the motto, and it demands appropriate wellness and approaches to prevent diseases and the supportive healthcare infrastructure to cure, treat people adequately to increase life expectancy. Healthcare infrastructure are one of the very basic social infrastructure components, and it is capital of any nation to support public health. We have been talking substantially about the physical infrastructure, the components of urban renewal, the impacts of urbanization, the areas which are informally developed, and so on and so forth. And that what Mr. Pai just mentioned, the concerns of providing a better habitat to people. I think we have reasonable solutions to some of these problems where we invite the public-private partnership into these models and create a mechanism by which we provide for such people to be dealt with first before any such development takes place. If we look at a greenfield development, usually we acquire a lot of villages, and most of these villages get transformed with time. So the first step to development is to develop those villages first, and then to create the necessary infrastructure for those villages and look at the peripheral land holdings which basically were held by these people and provide with affordable housing for those by virtue of a joint partnership which should come through the central government, state government, and with the private players who are going to develop that area as earmarked in the master plan. And once that investment is being done, we need to create the rental housing model. And then over a period of time, once the people who are responsible for shaping the city are being accommodated there, that can be transferred to other sectors of supporting informal sector, people who are going to service the development which is around, who would then occupy those houses and then continue to service the area where they are working. Apart from that, the brownfield projects and the redevelopment projects, there could be a reasonable approach to look at that 15% EWS component which has been allocated for any such large development, which could be asked for at the inception of the project. And that's what the developer should be building first to accommodate the people. We have got standard protocols which have been established to accommodate the workmen at site, and those can then be done primarily. And once those things are in place, these people who are responsible for shaping that development can be housed in that area, and subsequently again through cross subsidy model it can be transferred as a rental scheme to other people who could then service our area. So there could be some very, very well worked out models and mechanisms by which we could be looking at the development process as a whole. Now, the focus and the emphasis on social infrastructure when we talk about cities for people should become paramount. And I think here people first policy should be guiding the entire development process or developmental process of any city or any nation. Now, primarily for a country like India, where demographics is a very, very important component, I think we should be looking at the three fundamental needs of the people. One is health, second, education, and third is housing. So far, we have been able to achieve self-sufficiency in the sectors of food and clothing, but housing still continues to be a far-fetched dream to be achieved. And I think that's where the emphasis has to go. But then all that needs is to have create a robust social infrastructure, which is critical for the health of the people, and healthy people, healthy mind contribute to healthy economy. We understand that all this can be achieved through principles of social engineering, and government has to ensure right to health, which is paramount in the present times. And there could have been no better no opportunity of looking at the kind of status of health and the emphasis that we have given to health in our country, which is almost about at a dismal 1.4% of our GDP in terms of spending, as against 9.9 percentage, which is the of the GDP spending globally. Even countries like Sri Lanka spend 4 times our current expenditure on health, and that has exposed the complete healthcare infrastructure, which is not capable of dealing with a pandemic of this scale, though most advanced countries also have been humbled by the pandemic that we are dealing with now. But if you look at the 17 Sustainable Development Goals, health and well-being is the third most significant goal and as part of the 2030 agenda, and it reflects the complexities and interconnectedness between the two. The global scenario for health finds a gap of about 31 years life expectancy between countries, and the statistics inform us that about 400 million people have no health care and 40% lack social protection. Some 1.6 billion people live in fragile settings. Protracted crisis and weak national capacity to deliver health care is a significant challenge. By the year 2017, some 21.7 million people were living with HIV and were receiving the antiretroviral therapy, yet 15 million people await treatment even today. So if you look at the global health scenario, 7 million people die every year from exposure to fine particles in polluted air. So the environmental condition in the cities, as we see of, and the levels of the PM 2.5 and PM 10 are a very, very significant concern. And this has becoming a very important area of the disease burden in our cities, with the pulmonological problems going far beyond the expected levels of what they are today. So the environmental conditions are significant, and they are significant from a healthcare perspective, from the perspective of quality of life of people across the globe. The fact is that about in 2 seconds, somebody aged 30 to 70 dies prematurely of non-communicable disease, which includes the lifestyle diseases like cardiovascular diseases, respiratory diseases, diabetes, or cancer. And India has become the global diabetes capital of the world. By the year March 2021, we had more than 117 million confirmed cases and 2.6 million related deaths as part of the pandemic that we're talking about. Now, this has triggered a lot of anxiety, and it has overwhelmed the health systems, and probably it has potentially triggered the lasting geopolitical change. The kind of demographics that we were dealing with, I think the country like India demanded a lot of insulation of people from this pandemic, and probably the right kind of strategies and the deployment of the strategies at the right time to insulate people and probably to deal with it in a very much more effective manner through right set of protocols was probably required. And probably somewhere we underestimated what the implications of this pandemic could be on 135 crore people that we are dealing with. And no matter, there were successes in some parts of our first phase, but probably the second phase has bounced back with much greater power, and probably the estimates and the statistical modeling for the third phase is even more scary with the kind of stress that the healthcare system is going on. as of now. So the coronaviruses, as we know, a class of respiratory viruses, which has caused or begin with common cold to severe acute respiratory syndrome, which is SARS, and Middle East respiratory syndrome, which is MERS. And humans are expected by exposure to various this virus and variants of these viruses as respiratory liquid particles from tiny aerosols, which are less than 0.0005 centimeters in size, to large droplets. Now, these aerosols may cause transmission, particularly in crowded areas, in confined settings with or high density areas where we look at more intense development, and the intensity of development is very high, inadequate ventilation, poor hygienic conditions, and so on. But rightly so, I think we would have been in a much more difficult situation, but for the initiatives of Government of India, which have gone through the Swachh Bharat Abhiyan, the Amrit programs and urban renewal programs that have gone in, which has certainly improved and enhanced. One is the provision of the public toilets, shared toilets, reduction in the open defecation, and so on, which certainly has improved the quality of the hygiene in the area that we are dealing with. So I'll just show you a small video.
So far, we have considered two main routes of transmission. One is infection by coming into contact with something that has the virus on it. The other is infection through droplets emitted in sneezes and coughs. But some experts say there's possibly a third infection route.
Experts are now looking at this new infection mechanism as the key to preventing the further spread of the virus.
ただの会話の中で感染が広がっているとか、ある程度の距離があってもそれが広がっているような、そういった事例を見ると、通常の飛沫感染だけでは説明できない。非常に小さな粒子ということで、マイクロメーターの粒子、マイクロ飛沫感染と呼べるような、そういった状況が起きたんじゃないかなというふうに考えられます。
So how does this take place? NHK is conducting an experiment with a group of researchers. The team will track particles in the air using laser beams and a high sensitivity camera. This technology allows us to detect droplets as small as 0.1 micrometers wide. The experiment starts. First, sneezing. We can see a large droplet about 1 millimeter in diameter. It quickly falls. But let's look through the high sensitivity camera. We can see small particles that seem to glitter floating through the air. These particles are all smaller than 10 micrometers, or 1/100th of a millimeter in diameter. Let's take a look from a different angle. They're small and light. You can see them drifting through the air. These are microdroplets. We're learning that sneezing isn't the only source of these droplets. We ran the same experiment on a close-range conversation. People generate a lot of microdroplets when they talk loudly. The droplets between these two stay where they are. They don't drift away. It's not yet known what volume of microdroplets leads to infection. But Tatada says we can't rule out the possibility that microdroplets have spread the virus to some extent.
そのマイクロ飛沫、小さな粒子の中にもたくさんのですね、生きたウイルスがいて、大きな声での会話、あるいは激しい息遣い、そういった中でですね、このマイクロ飛沫ができて、それが近くの人、その人が吸い込むことによって感染が広がる。そういったリスクが見えてきたものと思います。
The risk of infection through microdroplets becomes even greater in a closed space with poor ventilation. This lab is simulating the movement of microdroplets in an airtight room. About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets shown in red continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, 20 minutes later, the microdroplets are still floating in place.
空気がよどんでいると、つまり空気の流れがないということで、マイクロ飛沫そのものは、落ちたり、違う場所に動くことはできませんので、長時間その場所にとどまるっていうことになります。
But there is a way to prevent this stagnation of microdroplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, microdroplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって、感染のリスクっていうのはかなり下げることができるようになるんじゃないかなというふうに思います。
So I think this short video explains as to how the spread of the infection happens. And apart from that, now it's almost well established that it's all airborne, and probably the containment of that is becoming very, very difficult from that perspective. But for going in for the right kind of COVID protocols, which have been prescribed by the WHO, which talks about the first protocol of using the mask, hand washing techniques, and avoiding crowded places. So I think that's the first, the basic advisory that came from WHO, and that seems to be very, very critical. Now, the fundamental problems which we face today in terms of healthcare infrastructure are basically, which are capital-intensive, hospital-centric model of healthcare. Of course, as per the World Health Organization, half of the world still lacks essential health service, and about 90% of the countries have reported disruptions of health services during this pandemic. Now, this is something that we are encountering and we are struggling with on a regular basis, and it is quite similar in the Latin American countries, in African countries, and all developing countries in the global south. So the objective again is to look for healthy lives, and we look to promote well-being for everyone on the globe by 2030. And as far as this challenge that is in front of us, it needs to be now achieved, then we need to look at how we connect with people and the communities to deal with this, and to ensure that every person on the earth has equal access to the highest standards of the preventive and clinical care. Coordinated data-enabled approach is essential. Something that Mr. Mishra was talking about is that how the IT technologies could be adapted to in probably providing better access and better healthcare to people at large. Now, in terms of our preparation, I think we need to be collaborating with various sectors and various players who would provide healthcare. The risk of this infectious disease and the epidemic going beyond the control is very, very critical, and probably that what's demand strengthening and coordination right at the beginning, which begins with the 3 steps of testing, tracing, and treating. So if these things are accelerated, I think we should be able to deal with this in a very, very effective way. The right kind of technologies like synthetic biology, sequence data, and enable rapid prototyping, testing, and deployment of vaccines would probably help us to combat it in a much, much better way. Apart from that, we need to have a more agile, adaptable, and crisis-resistant supply chain of critical goods. So I think the problems that we have encountered recently is the problem of the management of the supply chain system, where we were unable to deal with the requirement of the oxygen that was falling short and could not reach the hospitals in time, which also translated into several deaths. So probably this kind of management using the right kind of platform of the IT technology could have been dealt with in a much, much better way. And probably some of these exciting moments and the anxious moments that the citizens had to undergo could have been avoided. So providing and enabling access to health is one of the greatest challenge. And I think the governments at all levels will have to be very, very proactive to deal with this. While we understand that as per the Constitution and the 7th schedule, health, urban development, education, they are all part of the state subject. While they further percolate to the lowest level, which is the Panchayati Raj institutions, which deliver the primary health to the people in the villages. Now, the issues which are connected to healthcare and the struggling healthcare in the urban areas itself is overwhelming. Now, you can imagine the mammoth scale to which this problem can aggravate when we have absolutely very, very poor infrastructure in the rural areas. So God forbid that this goes beyond and we are unable to contain it to that extent in the rural areas, though there are reports coming in that has already percolated some of the rural areas. But in case we combat it effectively, we should be able to contain it at the earliest. And that's where we need to invest into the right kind of healthcare technologies, invest into digital innovation, connect mechanisms through apps, through communication technologies, mobile technologies, and use telemedicine to reach out to those areas which are deficient in the healthcare facilities. That's where probably I think our action and our proactive action would be very critical. We, as it is, have a very, very substantial burden of diseases that we are dealing with, but this pandemic has added on further because the kind of regular disease burden that we get is as a consequence of all the tropical diseases that we deal on a regular basis, like typhoid, cholera, dengue, malaria, and so on. But then now this has added another compelling layer for us to deal with it. Now, in case we are able to share the data, we are in the process of network and ensure that supply chain is being maintained, and there is an equitable sharing of the healthcare facilities, sharing of resources wherever it is possible, and reach out. As Mr. Sen mentioned, that we are in a state of war, and in the state of the war, the country has to be fighting it collectively and together. Now, this demands a lot of public policy and governance-based initiatives to deal with COVID-19. So the public policy and the governance is critical to deal with these large-scale emergencies, the kind of protocols that need to be set forth in terms of the public distribution system, in terms of the supply chain management, in case of access to healthcare, and creating multiple other players and bringing in the private players into the system who would be able to not only contribute to the effective management of the pandemic, reduction of the burden on the hospitals, look at the home care and the kind of facilities that can be provided through home care, which can certainly ease out the load, will be very, very critical. And that's where the public policies and the policies of the central government, the advisory from the central government to the state government, and subsequently translating it to the grassroots level will become very, very critical. Now, the critical problem here is in terms of access to treatment and the kind of testing that is to be done, which is very, very important. Now, the critical impact that we have seen as a consequence of the pandemic is the issue of the impact on the mental health of the people. And we are seeing that there are increasing problems, psychiatric problems. At the same time, the issue of peace within communities, the kind of scenarios that we are experiencing in countries like even United States, where there is a conflict between ethnic communities, I think are very important areas of concern, particularly for developing countries like India, where we have to ensure that we have the confidence building measures which will ensure peace and resilience within communities. We come together to fight this pandemic together, and probably as a community, if we deal with for the well-being of the people at large, I think it should work. We need to be trusting the local solutions and the local approaches to deal with such pandemics. Look at the local leadership, the kind of processes that can be brought in to get the communities rolling in. The initiatives that were mentioned by Mr. Sen are something in those directions, where we are empowering the local communities who are taking the local leadership role and in providing better healthcare facilities, and they're supplementing the overburdened healthcare system as a whole. Now, cities and urbanization are almost integral. The kind of urban sprawl that we are looking at is going to impact us in long run. But at the same time, in case we look at a structured approach towards development, and probably the politics of development, which is probably a more difficult challenge to deal with, probably would reduce the kind of the housing that we see for the urban poor, the slums that emerge and evolve, the squatting on the public land or unauthorized occupation. All these, which ultimately translates into shanties, they all can be overcome if there's a very targeted and focused approach to dealing with cities, providing with the right kind of physical infrastructure, looking at the approaches towards decentralization, capacity building in the system to ensure that our trunk systems still service us for a longer period by decentralizing, by looking at the local area, by looking at the smaller neighborhoods and making them self-sufficient through the decentralized approach for all management of water supply, sewage, waste management, alternative energy generation, and at the same time using the right tools of public participation in this process. Now, urban resilience, the term that we usually call, is a measure of how well communities, businesses, and government agencies can withstand both temporary shocks and the chronic stress that we see in the urban environment. The Rockefeller Foundation has funded City Resilience Index, which provides a dozen of indicators. We have the livability indexes, which are already there in place, and they can all be used to measure the level of in our cities. And this is some area which has to be integral to the development process and to the development of all the cities per se. And these are again an important indicator in terms of the resilience. Also could be an indicator for the smartness of the city. Now, this have to be dealt with very, very effectively. And here the role of good governance, the right kind of investment in this area would be very critical. The right kind of models, the right kind of strategies that have to be deployed, and which translates into right kind of tactics using the e-governance model would be very, very handy in dealing with such situations. So how resilient the urban area is probably would be a measure of the wellness and also the index of the quality of life in a particular city. Now, we have had seen some of the good examples of countries dealing with this pandemic, which have boosted their resilience, particularly because they had dealt with SARS earlier, namely countries like Singapore, Taiwan, China, and to some extent, even good strategies as deployed by New Zealand, Australia. They have all been able to insulate their countries and been able to prevent this kind of expansion. So now the issue of not only the local governance, the global governance again becomes very critical, where we are dealing with inequalities, both social economic fallout of COVID-19, climate change, and migration. The demigration that we saw of late as a consequence of the inception of COVID in India. So these are all very, very different kinds of concerns that we are dealing with. And here we need to be looking at a lot of multi-stakeholder efforts, the global cooperation, the cooperation between states, and the federal cooperation that we are talking about in this country, which needs to be taken about very clearly. Now, apart from that, agile governance means it's just more than coordinating effective, efficient, and reliable public-private institutions and managing problems and looking forward to an approach that seeks and anticipate problems before they materialize. That means it's like projecting a scenario, and it's all part of the scenario planning. That we, while we know that the third stage is bound to come, so how do we deal with it? Now, the third stage, as we see that the way this pandemic has been progressing, has basically looked into the problems where it attacked the people above 60s in the first phase. The second phase, it has come down to the real working group or the young generation, people between 30s and 50s. And now the projection is that the children, which is going to be a very, very scary scenario, might get affected. Now, to work towards that and to prevent this spreading to that target group is the challenge, and how we deal with it, how the governments and different stakeholders come together to deal with it, and how we create the infrastructure, no matter even if it is temporary infrastructure, that we are able to contain and provide the right kind of support as may be required to the people or children who might possibly get affected. Like, we need to push the vaccination program effectively, so that ultimately, in case such a scenario happens, the parents would be essential to be taking care of the children while they have to be provided to medical support. Now, in case that scenario happens, the parents themselves have to be vaccinated. So I think a very, very exhaustive program has to be put in place, and this demands civic participation. I think it starts both a bottoms approach, right, where people themselves become participants in this process, and then there's a top-down approach where the government and the civic agencies become critical to these. Now, here the situation is that we need to be blending both the global, local, all kind of opportunities that exist to us, and use the resources rightly, and equitable resources as we could use rightly. Now, looking at the current scenario of COVID-19 today, we have about 2.40 crore cases. There are some 37 lakh cases which are active. 2 crore people have recovered. About 2,62,000 people have lost their lives. And probably this is a spike. If you see these curves have really gone up substantially in the second phase, while the curves were reasonably flat till April, and then there's a sudden surge. And so at all fronts, I think we need to be looking at so far the administration of the vaccine till 13th May was about 70 lakh doses, which need to be enhanced much more if we have to combat the third phase. Now, a lot of efforts have been undertaken by the government of India to look at and probably deal with this. A lot of research has gone in, the Bharat Biotech's vaccine, the collaboration of SII, Serum Institute, with AstraZeneca coming up with another vaccine. I think they're all movement in that direction. But somewhere I think the lesson that has been learned from this pandemic is that it won't let us to declare victory too soon. So I think we need to be very, very vigilant in declaring victory over this pandemic. It is coming in different ways, in different forms, and the kind of mutations that is happening is challenging us on a daily basis. So I think that this needs to be worked very carefully. While other technological initiatives are being undertaken by government through various agencies like BEL and other government bodies which are working towards various mobility solutions in ensuring that technology is also infused, besides a lot of CSIR-based bodies which are working into the development of various technologies and also the medication that would be utilized for this. Now, private players in the industries have also contributed. A lot of hospital chains have come together to provide for affordable costs of the healthcare. And this is a very, very positive movement in that direction, where people and the players and the industry is coming together, which is looking at this pandemic as social responsibility on a larger scale. So we see that there is a lot of diversification of business approaches. There is a very definite focus on looking at healthcare and providing the supportive systems to the existing healthcare infrastructure. This has also led to a lot of mergers and acquisitions over a period of time in the last 1 year. So ultimately, the healthcare delivery in India is being segregated from a primary health center, which is the PHCs, to the secondary health and the tertiary healthcare, and being distributed along different tiers to provide. But the national health policy certainly has been focusing on the system of wellness and probably looking at wellness as a very important preventive indicator or preventive tool for people to generate their own immunity to be able to fight. But the challenges that we see are in terms of the inadequacies in the healthcare infrastructure, dispersal of healthcare infrastructure, impact on the economic development, and also the kind of the current status of the healthcare, which Supreme Court also has observed that in about 70 years, the kind of emphasis that should have been given to the healthcare has not been given. And probably that's become a point of big challenge as of now. Of course, we see substantial growth in the last 1 year, where almost about 1.3% enhancement has been done of GDP, but we expect it to be realized by the year 2025. The current ratio of doctor to patient is about 1:1700, which is intended to be brought in to about 1:1000. But the critical problem is which the hospitals are facing, and it's a global problem of the hospital-acquired infections, which has to be dealt with parallelly. Now, so there is an existing disease burden, there is an add-on burden of diseases by virtue of the pandemic, and probably the healthcare in a very, very difficult state as of now. Of course, the scenario has been projected for the Indian healthcare sector has been fairly positive, where we look at healthcare to be the largest employer, but of course, the kind of human resource that we need to generate, the kind of nursing care, the kind of medical assistants, the people who would be providing for the medical technologies or medical technicians. I think all this need to be revved up very, very quickly if we have to deal with this through a skill development programs, through short-term programs, and probably would also contribute to a lot of employment generation to combat with this. So there are growth prospects. We are growing substantially, which is expected that the healthcare industry will reach about $372 billion US by the year 2022. And we are looking at this growth, which is very critical. Of course, the kind of expertise that India offers has also become a very important factor for medical tourism. And we have been able to reduce the maternal mortality ratio and also the infant mortality ratio in the last 10 years considerably. So there is a very favorable investment environment that exists today. And there are a lot of incentives which the government of India has been giving in terms of tax benefits, tax holidays for people to invest into these areas of healthcare. So healthcare fundamentally has 5 important components, which includes hospitals per se as healthcare facilities, the pharmaceutical industries, the diagnostics, the medical equipment and supplies, medical insurance, which is a very, very important area as of date, where the insurance sector has grown. Of course, it has grown over the last 1 decade, but the current access to medical insurance is about 37 people are insured on their own, while the Government of India schemes through the NHPS, the CGHS scheme, the Prime Minister's Jan Aushadhi Yojana, the Aam Aadmi Bima Yojana through LIC, and the ESIC, they have all contributed to providing healthcare, but probably better innovative models of medical insurance could be done. One such model was being projected by Dr. Devi Shetty in Bangalore, where he said, you just give me 5 rupees per every electricity bill, and that goes to add on to towards your cross subsidy towards the health insurance. Now, these kind of mechanisms will have to be brought in, where the larger cross section of people get medically insured, and they are not limited to get into seeking healthcare facilities as may be required, because there's always a lot of out-of-pocket expenses that people will have to incur because of the affordability of the medical facilities. The telemedicine is again going to be the big changer in the present times, and a lot of people in the last 1 year we have seen have subscribed to telemedicine and the teleconsultation which has happened, and this can certainly guide the rural areas and probably to combat and assist the healthcare providers in those areas to deal with the pandemic. Now, of course, this needs a lot of manpower and support of manpower to be generated. So we have been able to increase the number of medical colleges and to generate more doctors. It has grown from 476 in the year 18 to 529 today. By the year 2018, there is a substantial jump also in the number of doctors that are being produced every year. And I think we are looking forward to achieving the target of 1:1,000 by the year 2030. Now, the healthcare certainly has grown at a CAGR of about 16.28%, where we were at about 140 billions at some time in 2016, and is now going to be at about 372. The government has also enhanced its expenditure to 2.5 of the GDP, and the government initiative certainly fosters a lot of public-private partnership and public health surveillance in India. Now, going ahead from here, in terms of the design and development healthcare facilities, I think we need to be addressing the patient awareness and expectations, the location and level of care to be provided, the capacity building of our hospitals, and the generation of usable space by special, effective and efficient spatial planning, adaptive reuse of some areas, the possibilities and redundancies built into the system to expand and to take care of the surge capacities, the sustainable agenda, the systems approach to design, the flexible space design concept to adapt to changes, modular coordination, the standardization and optimization techniques for healthcare facility planning, and the budgets which have to be built in as part of resilience. So far, all healthcare facility planning in India does not recognize or does not have budget for healthcare resilience. And I think this has to be inbuilt both in the spatial construct, in the financial construct, and the redundancies which are being planned for expansion. So in case we are to provide for patient safety, we have to provide for safe hospitals, we need to invest into the right kind of strategies and provide for budgets with the right set of protocols and enforcement policies to be able to provide for adequate healthcare to our people. People now with the awareness are certainly demanding quality healthcare. The affordability is there to pay for healthcare facilities and for healthcare. New specialties are emerging, medical tourism are all there, and these need to be supported by the kind of developmental controls that are being prescribed by the city to help the healthcare sector grow and also utilize the developmental potential onto those sites. Now, coming to the disaster management, the whole idea of the Government of India of putting this pandemic as part of the Disaster Management Act 2005 is that this needs to be fought at the level of a disaster. And it falls within the purview of the legal provisions of the Disaster Management Act. And it employs a great important place in the policy framework of the government to ensure that the people, underprivileged people, are being affected, are being provided with a lot of relief and are being dealt with effectively. So as far as the Disaster Management Act, it talks about a catastrophe, a mishap, a calamity, or a grave occurrence in any area arising from natural or man-made causes, and that's what this is being focused under. And we are dealing with this at a magnitude of a disaster. So this is something very critical, and I think we have to cope with the capacities of the communities who are getting affected at a local area in that matter. Now, the issues which certainly bother us is the population density, and the issues of developmental practices, the climate change, and the kind of environmental degradation that we are observing. Now, the disasters can be basically divided into two types, the natural and the man-made. The natural are meteorological, topographical, and environmental, while the man-made fall in the categories of technological, industrial, and warfare. The natural hazards, of course, are there, and we deal with them. Even today, the western coast is dealing with the cyclonic storm, and that part is also getting affected by the vagaries of nature. And this is like a double whammy that we are actually in, where we are fighting pandemic on one side, and at the same time, the nature's fury is also impacting us parallelly. We know that the outcomes and the fallout of the natural disasters are epidemics and fire and many more losses that we incur in terms of life and property. And I think all these need to be managed very well through effective protocols, the right kind of infrastructure that is going to deal with this. The national response has already been put into place for this. The right kind of response teams are working. The international aid is coming to us, but all it needs is a judicious use of the international aid, which is coming to us at this point in time, without any kind of bureaucratic delays in the dispersal of the aid that is being provided to us. So the areas of the concern that emanate from this are the early warning systems and close monitoring, the mechanisms for integrating the scientific, technological, and administrative agencies, the communication links, the vulnerabilities and critical infrastructure, which needs to be retained, and the resilience that is built into that, the relief that is to be provided in this case, the kind of preparedness and the mitigation which is critical to our requirement. Now, the four dimensions of disaster management includes, to begin with, mitigation at the first place, the level of preparedness that we have, the response to the disaster as part of the disaster life cycle, and the recovery from the disaster, and then again to be able to create mechanisms for mitigation. So disaster mitigation, for that matter, becomes a very, very important measure if we have to deal with such kind of pandemics and catastrophes. Now, this demands the assessment of vulnerabilities and right kind of risk assessment to be undertaken. And I think there are great learnings that we have from the pandemic to deal with this kind of a situation. Of course, there's a great learning not only in India, but globally. So when we look at some of these, I did a small quick modeling of the disaster management and mitigation disaster. And this is with the case of Delhi, where we tried to look at the various plans of Delhi, which includes the geological map, the hydrological map of Delhi, the microzonation map of Delhi in terms of seismic intensities and the correlation to geology and the fault lines, and then the kind of outcomes of the macrozonation, which talks about the hazard index of various areas. And onto this, what we tried to do was to look at the densities with the seismic hazards, the geological hazards, and what you see is the mapping of all these red dots is the distribution of the healthcare facilities in Delhi. Now you can see that how the dispersal of this social infrastructural component has been done. And it is equally important that in case of disasters, we are being able to deal with this healthcare facility, because hospitals, if they are affected, then what kind of treatment, what kind of relief we would be able to provide to the people. So you see the dispersal, and I think we feel that a lot of areas, particularly in the northwest area, part of north areas, some northeast and southwest, are grossly deficient in the healthcare facility dispersal. And these are the pointers that need to be looked into from the point of view of the master plans, and the way this dispersal happens from the perspective of density in the city and the density management per se. Now, this is a critical marker which we will be looking into very carefully, and this is the kind of larger distribution with respect to the city of Delhi. Now, looking at the disaster resilience per se, I think it is the capacity to adapt to the changing conditions and to maintain and regain functionality and vitality in the face of stress or disturbance. And the capacity to bounce back after disturbance or interruption is the capacity to be resilient to such adversaries. Some of the pointers and some of the critical factors that government could consider as part of creating more resilient societies. There are this 10-point consideration. One is to hone virus control and reimagine healthcare, unleash learning revolution, shape resilient trade and supply chains, distribute effective stimulus measures. The fifth part is deliver contactless government, manage sovereign balance sheets with an investor mindset, institutionalize best practice crisis response to prepare next crisis, make faster, better decisions using data analytics, cultivate smarter and more productive ways for public servants to work, and foster new forms of partnership with the private sector. This translates into the right kind of future and the planning for future, which looks into the road ahead for us, which includes the appropriate land use planning, the dynamics of the development, the social integration, and the way communities are to be dealt with, the value, the quality of the built environment correctly, get the feedback from right people, be adaptable, and at the end of whatever we have done, ask the question, what if we were to do it differently? And what is if this has to be looked into a different ways, in a more innovative way and more appropriate way. And I think there are these series of steps that can be followed to look at more resilient healthcare facilities. So I'll conclude with the last slide, which says, what are these steps to resilient design? Is that one, that resilience transcends scale. Resilient system provides for basic human needs. Diverse and redundant systems are inherently more resilient. Resilience anticipates interruptions and a dynamic future. And last but not the least, resilience is not absolute. So I think with this, the steps that could be looked into as a part of the process is to perform a risk assessment, review the current systems and protocols, design of healthcare facility, protocols, policies, examine the current infrastructure, and protect the vital functions. That's about all. Thank you very much.
Thank you so much, sir. If any of the participants have any questions in mind, you may now clear those. Anyone? I think the participants doesn't have any questions. I thank you once again, sir, for sharing your thoughts with us. I really appreciate that you have joined us and have shared your thoughts with us about, and with such nice words. Thank you, sir. Thank you so much.
Thank you very much. I'll just stop sharing my screen.
Sure, sir. I would now like to request Ms. Vinita Shetty to speak on the topic of unbilled back data. Ma'am, what's your ma'am? Ma'am, can you please unmute yourself?
Okay, if Biswajit is there, I'm going to ask him to kindly show the PowerPoint so I can go through.
Is it visible, ma'am?
Yes, it is now. Yes. Thank you so much. So if you can play this in full screen. Can you make it the full screen?
Yes, I did it already.
Oh, because it should be, it's not in full screen.
But I already do it in full screen mode.
Is it playing? Because, okay, because you should.
So
You should
can you just start the slideshow? I think then it will
slideshow.
will become in full screen.
Yeah,
Yeah,
start
I have
the
already.
slideshow. Next to animations is slideshow, so maybe you could start that. Click on slideshow next to animations.
Ma'am, you please start. I'm doing because
Okay.
there are some.
There you go. Okay. So thank you so much again, and I'm very sorry for the problems of Keynote and PowerPoint. There was some incompatibility. Build Back Better is a slogan that has had a lot of policy. It's a very current slogan with the rallying cry of Joe Biden's campaign in 2020. It gave it a particular boost. And the World Bank uses the word Build Back Better to detail devastation disasters like tsunamis and how to bounce back from those. I'm going to sort of build on some of the humanitarian relief and the restoration of services and even the infrastructure solutions which are being proposed a bit ahead of me to look at, the OECD definition. So if you go to the next slide, the OECD, Biswajit, if you can go next to the next slide. The OECD invoked the phrase "build back better" in the context of post-COVID-19 relief to encourage governments to respond to environmental threats like climate change and biodiversity as they get back on their feet through recovery packages. So COVID-19 recovery and green recovery, they are concurrent problems which are part of a unified problem. And just to quote the OECD on this, a central dimension of building back better is the need for a people-centered recovery that focuses on well-being, improves inclusiveness, and reduces inequality. And my proposition is to unbuild back better. So it's not so much about the physical infrastructure, but communities and ecology, which is at the heart of recovery. Next slide. I appreciate the opportunity to offer the perspective of urban practitioners. I'm not an urban practitioner myself, but I'm by pedigree, I'm a global technology journalist, but I do lead a community of urban practitioners called Placemaking India, which is a voluntary organization. Next. Slide 4. So we take our pride in our parampara. We draw roots from Jane Jacobs, the American-Canadian journalist and activist who butted heads with Robert Moses he was planning to build this Lower Manhattan Expressway, which would have been completely destructive of the Greenwich Village neighborhood which currently exists. Fred Kent, who worked closely with Jane Jacobs, co-founded Project for Public Spaces, which has become a byword for public space creation and improvement in US. And his son, Ethan, has internationalized the focus on public spaces. So I'm supported by Pratima Manohar and Fiba Thomas, both pioneers in placemaking in India. What follows is really a dozen ways to unbuild back better, and they've been crowdsourced from our partners and members who are spread all across India. So if you go to the next slide, and we'll move ahead in the interest of time to the next one. Number 6. Number 7. I just want to stop here to quote Fred Kent, who said, "Everyone has the right to live in a great place, and more importantly, everyone has the right to contribute to making the place they live already great." So then if you move on to the next one, to number 9. So one of our founding members, Prerna, is an expert in earth architecture and teaches at Academy of Architecture in Mumbai. And she spent a lot of time researching the slum developments in Mankhurd in the western suburbs of Mumbai. So in answer to, the Durga Shankarji's question, why do slums come? And I was really refreshed. It was very refreshing to hear Ajit Pai saying that, can we make informal settlements sustainable where they are? Because this is one of the problems. Slum dwellers taken out of their settlements, seemingly because of diseases and unhygienic living conditions, and shipped to another corner of the city in high-density dwellings, which are possibly worse for the spread of airborne diseases and like tuberculosis and COVID-19. There's no livable open space around them. So it's no surprise that the first wave of the pandemic hit here in this close-knit urban form. So poor quality housing, I realize this is sort of inherited, but it is something we need to deal with. I'm not sure what the answer is, but better land management and redefining land capture value is going to be really important for the coming future. Next slide, please. Number 10. The second wave hit uncrowded tier 2 cities like Bhopal. And here, this really brings home a project that Fiba Thomas, my fellow regional leader, South Asia manager for Healthbridge Foundation in Canada, she responded to the pandemic by working with Caring for India. Now, running water for the vigorous hand washing that the WHO recommends is completely impractical for those who rely on community standpipes. And Healthbridge took on supporting the residents of informal settlements to access public spaces and ensure proper hygiene. And they do consulting right from the start. So one-on-one meetings with key leaders, including women and children, to identify the ways of implementing hand washing kiosks, mass distribution, improving existing and identifying public spaces. So they provided the wood, but it was the people themselves in these 10 slums who created the outdoor seating arrangements, which are appropriate for physical distancing. And they installed the hand washing kiosks in each of the 10 slums and undertook this and stewardship of this. So a contribution of 400 rupees was actually received from the community. That's just $5 US, but then you should be aware that these community members are the poorest in Bhopal, and such a contribution, although small, it was really a demonstration of their commitment. And another great thing that's happening, which I really feel very moved by is the hand washing kiosk is being filled by the private connections of the individuals because they have no public water connections. So they are filling this out of their own, private water. And rather than reproducing a slum at the other end of the city, let's take the fabric of informal settlements and make small incremental interventions without disturbing a lot. A place to play, a place to hang out, create a community life with less people breathing the same air. So this would be our offering for, the question of informal settlements. So you can move on to the next. Number 11, sorry. Now, this is not the usual photo of the Yamuna River. Sorry, could you go back to 11? Yeah, sorry. These are the floodplains of the Yamuna, where the food is still grown. And about 90,000 farmers make a living for the last 7 generations on this land. There's a plan to open up the Yamuna floodplains by the Delhi Development Authority to recreational activities. And the Yamuna riverfront development envisions a patchwork of biodiversity parks, cycling and jogging tracks, and recreational zones. And understandably, that's an attempt to bridge the missing link between the city and the river. But the problem is they require the removal of farming communities and practices. This despite the fact that when borders were sealed during the lockdown, it was these farms that were supplying food to Delhi residents. And now I don't have to be an economist to say, that let's shorten the supply chain. And is there a possibility of integrating urban farming with publicly accessible farms instead of raising the crops and evicting farmers? This is what would put us in the league of world-class cities like Singapore and Seoul who are doing this. So integrating urban farming, encouraging people to come and even farm from the city and make them parks. So this is one solution offered by Swati Janu, who's one of our partners, the Social Design Collaborative. Next one, please. So it's pandemic time, but street design is really pertinent here. It's not a matter of beautification. It's more relevant than ever. People are being required to queue on the pavement for essentials while observing physical distancing. Delivery vehicles need to park as home deliveries, become the norm. And this is one of the best times to reallocate road space by correcting the street geometry. Traffic calming allows pedestrians to walk and cross the road without the heart in their mouth. Ajit Pai mentioned, let's get the infrastructure going, sewage systems, airports, railways. Let's also think of how to have cyclists, get their own two-way protected lane. And these are very simple things to do through asphalt paint and color coding. This is a project done at the Lakshmi Complex Junction in Coimbatore City with the cooperation of Coimbatore City Corporation. And one of the problems that Pavitra Sriram ran into was with the Highways Department, which claimed that space as they started building on it. So if some of these street challenges that Durga Shankarji described are to reach fruition, there needs to be closer coordination between the local authority and the highways department. We cannot have traffic speeds on this highly dense retail destination where there are about 15,000 pedestrians on any given day. And another learning from this project was the need to update this 3-meter rule for motor cars. This is a rule that dates back to the colonial era and it overlooks the need for pedestrians. On the top right, you can see a parklet designed outside the famous Annapurna Hotel in Coimbatore. And in what normally would be occupied by one parked car and one two-wheeler. This seating has been now accommodated in a very different way. So raw wooden crates were set up, and 2 days before they were actually painted, people had already gone and occupied this place and they placed ownership on it. So this really brings home the way that people really want to use their streets. and build it, and they will come. But build it in a different way, in a small scale way. Next, please. Durga Shankarji also mentioned bicycling. So it's not just a cycle, but it's independence. And one thing that Bangalore has been struggling with is that for a population of 1.2 crores, it has over 80 lakhs registered vehicles and counting. And often women are edged out of the rightful place on the city streets. This is Manju George taking a picture. She recently joined the Karnataka Urban Land Transport. And one of her big priorities is to encourage women to get on bikes through women's bicycling clubs. And open street events of this nature. These are women doing a tire race through street in Bangalore. So they replace car traffic with people traffic, where streets become places for people of all ages, abilities, and background to come out and improve their health. This is also being done in Thrissur. Every year, the World Car Free Days event is organized, World Car Free Day event for the last 4 years. And through these initiatives, we make people understand the importance of car-free streets, physical activities, community cohesion, and the quality time that people get to spend. I can't, say enough about that at this particular juncture with the public health condition. Next one, please. So this is Sukrit Sen. He has been hard at work volunteering for the COVID-19 second wave, the safe houses that Debashish Sen mentioned. Sports club has been converted into safe houses to isolate patients. School buildings have also been converted, and he's really active in that respect as an architect and a musician. One thing he's found that the traditional Kolkata cafes have shut down, but the terraces have become the new place for chatting across the buildings. And open air cafes, gardens, sitting in nature, this is becoming the trend. And I hope urban administrators are looking at this and planning accordingly. One trend Sukrit has noticed, the city roads have been taken over by bicyclists, and the prices of cycles are going up because of the high demand. So there is a COVID cycling community that he belongs to. And what's happening is the sales of cycle are going up, and that also means more livelihoods for people selling, maintaining, and repairing the bicycles, who are often from the marginalized sections. So one other thing I would sort of point out is that electric vehicles, I think so far the emphasis has been on buses and public transport, but there's also support needed for electric micro-mobility. And there's probably a whole industry waiting out there to pick up. So if you go to the next slide. This is Ahmedabad, which is a World Heritage City, one of two that we have in India. Now, heritage is something we normally associate with the built structures, but Harsh Prajapati, who's a Gujarat hub leader, he went the length to get community recognized as part of the intangible heritage. So getting the residents to engage on the importance of public space, encouraging them to reimagine a public space. Eventually, some people actually contributed in terms of spare furniture they had at home, and some brought color paints and changed the empty walls. So dead space in a busy street became a vibrant, welcoming place for people overnight with the help of local residents. And the end result was people who were having a jam in the night, peak hours. This is before COVID, of course. And what is the amazing thing is that the space has become part of the Ahmedabad Heritage Walk after this intervention. So people actually stop here on the Heritage Walk because it's community getting together. Next, please. We have somebody in Lucknow who's a heritage conservationist. She's part of the Lucknow hub. And Lucknow is one of the cities which hasn't had a communal riot. There's a great deal of communal harmony there, the Ganga Jamni Tehzeeb, as they call it. And it's something that's really worth cultivating. Syncretism actually equates to soft power. And Hindus making taziyas for Muharram, Muslims celebrating Bada Mangal. I've seen this in Ajmer as well. Hindus growing roses for the shrine of the Sufi shrine. These are the things that really enhance our soft power. And I can't emphasize enough how important it is in the cities to continue with this syncretism and embracing each other's religions. Next one, please. The art is something that people might wonder, what has it got to do with the, what does this pure decoration have to do? Can you please click on the, yeah. Can you click on it? Okay. Art is not something purely decorative. It's a fundamental expression from one human to another. And it allows us to examine what it means to be human, to voice and express, bring people and art together and ideas together. And as we rise to the challenge of a new normal life in a global pandemic, it's time to value the arts. Even during the pandemic, Start India, which is Street Art India actually, has done a number of interesting projects. One in in Panjim, one in Patna, Bihar, and they celebrate some of the COVID warriors. So art allows us to communicate from afar, generate positivity, appreciation during times of, pandemic times, and also amplify important voices and messages. Several smart cities, municipal corporations have actually invited Street Art India to develop public art in the times of pandemic and across the breadth and length of the country. When artists create public art featuring masks to reflect our current experiences, they're actually sending a very powerful message to the public. See if you can go on to the next one. Children are some of our primary stakeholders, and one of the main objectives of the Bhubaneswar Smart City vision was to make the city child-friendly. And they had a number of events like Pathotsav, Parkotsav, and one of the really interesting aspects of this is that Bhubaneswar, they're trying to position themselves as a lighthouse city for child-friendly initiatives. They realize that the city needs guidelines which ensure child-friendly public spaces, not just in the design process, but also in implementing, managing, and maintaining public spaces. And if somebody said, if you could experience the city from 95 centimeters, which is the height of a 3-year-old, what would you change? And this is a question that should be asked by all placemakers, planners, designers, and decision makers. Because when we build cities for children, you're really making it, safe, accessible, comfortable, legible for all people. So build for the city in a building for all. Here are students, high school students, actually going around examining and surveying what could make a city safer. And on the right-hand side, you have kids learning how to maintain their own playground. So these are excellent initiatives by Devshri Shah, who's working for IBI Group, and this was done in Orissa. And the next slide, please. These are children, again, displaced by the tsunami in Chennai, and they were settled in Ayodhya Nagar in a resettlement site. And due to the pandemic, schools were not functioning, so beaches were closed, and schools were also closed. So that meant that they had time to revamp their neighborhood, make it healthy and inspiring for themselves. So Urbeser Sumit was involved in cleanup of this area, and plus a company that Dhanya Rajgopal works for, taught children as young as 9 to help with building, painting, and creating. And just with the help of a local carpenter, kids put together a mobile mini library with the help, of crates, and made a seating area with repurposed materials, and then plus crowdsourced toys and books during Children's Day week to set up the community toy and book library. So the next phase of this involvement is to pass on the stewardship to the community. So these are, things, simple and effective ways to transform spaces into welcoming learning and play areas using everyday objects. I just want to say in closing that let's not forget that COVID at its heart is a breach in the barrier between the wilderness and the city. If we don't manage our natural capital right, the next pandemic could originate in India. So it's very important to look beyond the city, and even within our city, the edges of our city, we have biodiversity and natural infrastructure such as forest and wetland and mangrove ecosystems. And these are essential inputs, many economic activities, and are central to hundreds of millions of livelihoods. And the OECD has pointed out that natural capital is undervalued in the economy. Ajit Pai is the nodal officer for the OECD as well. So I hope he's still on this and we haven't lost him. And together, I'd like to say at the very end, together, let's unbuild back better. Thank you so much.
Thank you so much, ma'am. If any of the participants have any question, you may now ask the question to ma'am. Anybody? Okay. I thank you once again, ma'am. It is our actually privilege that you have joined us and shared your thoughts with us. Thank you so much. Yes.
Yes. Actually, I have one. It is not a question. Actually, thank you, ma'am, for your wonderful lecture. I have experienced some public. It's regarding the utilization of public spaces during this COVID situation in COVID pandemic in urban areas. And I have experienced I have experience of two cities. One is both of them from West Bengal. One is Siliguri, and another is Kolkata. And in both of the cities, I found that during this COVID situation, common urban people, it is quite obvious that we have a tendency to utilize the public space, specifically the public open spaces like shopping mall, movie theater, but there are some restrictions that is imposed by the local government or state government. We can't move freely, but for our mental refreshment, I think that we have to utilize these public spaces. And from this point of view, my question is, what is your suggestion or what is your opinion to overcome this situation? That means we have to prevent this pandemic situation and we have to maintain the, not social distance, rather it would be better to say physical distance. We have to maintain the physical distances among us. But in spite of the fact, how would we entertain ourselves and in respect of urban amusement and recreation? How would you maintain our recreational life for our mental satisfaction in this pandemic situation? What is your views or what is your opinion, madam? Please.
Sure. Yes, Article 15 of the Indian Constitution guarantees every citizen of India equal access to public areas and the right to social equality. And I understand what you're saying. These are unusual times, and that right has been suspended. But let me give an example of Barcelona, where I spend part of my year. There were time slots given for children and parents to go out in the afternoon. Then older people above 65 could go out at a certain time, and the rest of the population, could be out. So there were certain time slots allocated. So people who are working, who had essential work, could step out during lockdown. At the working hours, at peak hours, but nobody else was allowed to do that. But the older people could then step out after the peak hour had passed and walk around, and then the children could walk and come out in midday. So this is one solution to the problem, which is designating times for people to step out in the public spaces and use the public spaces for recreation. And I can't agree with you more. And really, I hope this is giving a rise to, and especially among property developers and local authority, to the need for having some recreation space within 5 minutes walking distance. Within 15 minutes walking 15 minutes walking distance. So I think it's a combination of policy and some short-term interventions. There's no, everybody's suffering from the same problem all the world over, wherever lockdown has been introduced, because public spaces are the places to where you can restore your mental health, physical health. So does that answer your question, Tuhin?
Yes, ma'am. I have got your. I understood. I understood, and I agree with you. I agree with you, ma'am. Thank you, ma'am.
Thank you.
Anybody else? If you have anything to share, you can. Okay, so I think, ma'am, there's no such question raised. We thank you, ma'am, for joining us and sharing your thoughts. Thank you so much. We hope in future you will cooperate us again. Thank you.
Thank you. I'll be glad to. Thank you.
Okay, our next guest is Dr. Uttam K. Roy. Dr. Uttam K. Roy is an architect and town planner with more than 20 years of experience in urban planning and housing. He is currently serving IIT Roorkee as Associate Professor in the Department of Architecture and Planning. Earlier, he has served as Hudko Chair faculty at Administrative Training Institute, Kolkata. Prior to that, he contributed in the town planning of New Town, Kolkata as architect planner of the West Bengal HITCO, Kolkata. As a founder professor in charge of Spatial Planning Lab at IIT Roorkee, he is involved as the master consultant for Zonal Development Plan of Patna Metropolitan Area, advisor for Rental Housing Policy of Madhya Pradesh, and also involved as consultant in Bareilly Smart City projects. His recent research includes the urban mixed land use, land readjustment theories, and technology solutions for affordable housing. In 2020, he has completed a pilot project on spatial rural planning for the state of Uttarakhand under the Pan India Pandemic Resilient Initiative by the Ministry of Panchayat Raj, Government of India. Dr. Roy is also a recognized trainer of DOPT, Government of India. He has been the recipient of Outstanding Teacher Award of IIT Roorkee for the year 2020. Today, he will be speaking on the topic of new normal urban planning. Over to you, sir.
Am I audible?
Yes, sir.
Yeah, thank you, Antara. Sorry, actually, I got a call from one of my colleague who is suffering from colleague's house. Okay, now thank you very much. I think it has been a wonderful discussion today throughout the day, and starting with Dr. Mishra, and then the guest of honor, Mr. Devashish Sen, and then Mr. Ajit Pai, Professor Hajela, and then Vinita Shetty ma'am. And I think it's a wonderful discussion. Now, uh, let me tell you that all of us now, we are going through a very important phase of life, individually, as a community, as a nation also. Uh, every day I feel that all of us, we are getting news of deaths, crises, emergency situation, etc., etc. So when I got a call from one of my best friend, Professor Rai Chaudhary, about this webinar, I thought that I am not in a mood to discuss anything on in this crisis situation. We lost some of our students, some of our research scholars, you know, the reality. Then I thought again that why not? I mean, at least we get some time in the home, and why not we look back and reflect on the reality and try to do something or speak on something. So what I will be speaking about, I will speak very short because it is already almost 6, and already is 3 hours, and so I'll speak very short. Largely what I thought, that let us, like, when there is any pandemic or crisis situation, people are always involved in crisis management or the management of the instant situation. But you know that now, apart from the being closer to the family and the friends, the larger issues are there, okay, which we can reflect, we can discuss. And also, as a academician, as a researcher, as a professional planner, I felt that why not we look back, okay, we look back, go back to the history, try to understand that what could be our way forward from the past practices, or what may be the lessons from the past practices, what we can take and we can use for the future. So that's what I would like to share with you. I'm sharing my screen so that you can see the slides. Is the slide visible?
Yes, sir.
Yeah. Now, let me tell you in the beginning that urban planning or planning in general is a very large subject, very vast subject. It is very difficult to comment on what will be the like change or revision in the planning approach or whatever due to post-pandemic. It is very difficult. So what I thought, let me discuss in general on the one subject, which is land use, which we deal as a classical town planner in the cities. Okay, fundamentally we change the land use for creation of any city, any urban areas or any other areas. There are few answered and unanswered questions on the land use, so it is a good time to look back and to think about those. Now I would like to take you to 100 years back, 1918 to 19, precisely 1819, about the Spanish flu. Uh, Now there is number of pandemics. The COVID-19 pandemic is not the only pandemic, okay? But probably maybe during our lifetime, in this generation, maybe we are seeing the COVID-19 in a very large way. But before that also there was Ebola and H1N1, various other pandemics. So in 1918 and 20, even before that also there were many epidemics and pandemics. But why it was very important? Because due to this Spanish flu incident, a lot of deaths were there. Let me take the roughly death numbers. It was 50 million worldwide death, 14 million in India roughly, and 2 million in US. You know that during 1918-20, India was under British rule, and that time in India, apart from Spanish flu, during particularly in that decade, a lot of other epidemics like plague and all those epidemics were there. And immediately after this pandemic, when people saw that more people died than the World War I, okay, that is the level of the almost 1% of the total global population died in this Spanish flu. One thing you also have to know, that Spanish flu doesn't have any relation of origin from the Spain. Okay, it did not originate from the Spain. It is called Spanish flu because during the World War, only the Spanish media was the only independent media, neutral media, and they were the only media who were sharing the information on the Spanish flu. And there are many differences, like somebody tells that it is originated from US, somebody says originated from some part of the Europe, whatever it is. So important part is that after the huge number of deaths, all the governments they started to do something. Okay, so I will take the example of the American government, where a person called Hoover, okay, who was basically Secretary of Commerce, was appointed to look into the matter. And he said that basically, I just coined one line. He said that the enormous losses in the human happiness and in money, which have resulted from lack of city plans. And very soon, within 2-3 years, they came up with a pan-country planning law and they introduced to the planning law the zoning regulations. The fundamental of the zoning regulations was that to build the city in such a way so that the residential area, that is the living areas, are kept separate from all other non-residential land uses. For example, the industrial land use, commercial, manufacture, etc., etc. Okay. Now, this was in US. Similarly, similar other practices were there in other countries. In India, uh, there was effort from the British government to build the new capital complex in the Delhi, which we know as the Lutyens Delhi. But one very important approach what we find in history is that the works of Patrick Geddes. Okay, I would not take much time, but I would like to take that Patrick Geddes, who was basically a biologist turned town planner and who stayed in India during 1919 to 25, who propagated some other approach, okay, in town planning to make people's life healthy. So he told that it is the people who is the center of the planning, unlike the very strict zoning regulations in US and the way they wanted to make the city. He propagated some different approach. Nevertheless, what happened after that? So it was so stringent and so important in US life. In 1926, there was a court case between the village authority, the village named Euclid, and developers group Amber Reality. Why it is important? Because the reality group, they took the Euclid village authority to the court about their right to the zoning regulation, but the court gave a verdict in for the benefit of the people towards the Euclid village authority. So what they said, the exclusion of buildings due to business, trade, etc. from residential districts bears a rational relation to the health and the safety of the community. Precisely, they thought that if we segregate residential areas from the other areas, this residential will be areas will be sterile. Okay, it will be safe, it will be clean, green, etc., etc. Now, because of this landmark judgment by the Supreme Court, the next 40-50 years of town planning in US was shaped by this Euclidean planning principles, okay, which is nothing but the broad principles where multiple land uses, as we know, residential, industrial, commercial, traffic, transportation, public, semi-public, etc., etc. Okay, strict zoning regulation. That means in our house, if you have a bedroom or a living room or a toilet, okay, bedroom is used for only for sleeping. Living room is used for only for living areas, nothing more than that or nothing different. Similarly, like for city, it is the strict zoning will be applied for each zones. Limited mixing of land use. They did not allow the mixing of land use. That means within a residential community, you cannot have a shop or cannot have any other business activity. Okay, that mixing is not allowed. The consideration was that only that from the health and the safety perspective. Location dependent, that is the zone dependent, and largely grid iron plans. The typical layouts of American cities, what I am showing, you can see that it is a largely grid iron plan, which is nothing but the perpendicular juxtaposition of the roads and the street network. Okay, and the main planning principles were based on the travel demand based. Okay, that means in each zone, whatever travel is generated, and that travel is channelized to the other zones. Okay, and this way, the planner, they used to calculate the trips. Even now also they do trips and the travel, and they assign uh, the transport mode. That was the broad principles of the Euclidean principle. Okay, and it was followed not only US, up to some extent in India also. In India, even though we have a mixed kind of like Euclidean and the other approach, since we have a long history of the town planning in ancient time, and also a lot of influences of the Muslim invasion and the British colonial rule, whatever. So this was the, and also there was a control on density. They thought that if you go for very high density, okay, it will be very bad. Okay, initially that was the concept, but later on, after within 50 years, they 40-50 years they continued this, that because of the safety and all blah blah blah, it is important. But suddenly people started observing that no, it is not a good practice of making the cities. Ultimately, if we make exclusionary zone, the strict zoning regulation, the city is becoming kind of a different cells of different activities, and we don't see the people on the street. Okay, the city is for people. The earlier speakers, they have mentioned this. Okay, but you will astonished to know that the US people, they took 40-50 years to understand that. Okay, and they propagated starting from 1960s. One journalist turned town planner, Jane Jacobs. It started with Jacobs, and but there are other critics also. So they started criticizing the segregated land use, and they started and because they said that there is a lack of vibrancy, social safety, longer travel need, because even for buying a small thing, okay, you have to travel to the immediate commercial complex, which is maybe a 5 to 10 kilometers away, so you have to take your private car. Okay, and it is largely inconvenient. Okay, in typical Indian practice, you will find that in every mahalla, every para, every gully, you will find a small shops, and you will get your convenient things. Okay, but it is not was the case for the US. Okay, whatever, and it is all private travel dependent. Based on that, it faced a lot of criticism. Then the concept of new urbanism and the more inclusionary approach came, where they tried to include people, multiple land uses with the town planning principles, and they in slowly it became a kind of a trend or the tradition from the maybe say 70s 80s until 2019. where they propagated just the opposite thing, high, that mixed land use. So in contrast to the segregated land use, high density in contrast to the low density, compactness, okay, instead of staggered development, transit oriented, slow streets, okay, complete streets, non-motorized transportation, and people-based urbanism. Okay, this is what they propagated, and you will be astonished to hear that yes, the Western people took very important learnings from the classical Indian streets. For example, this slow streets or the complete streets, where each and every mode, including the pedestrian, cycles, three-wheelers, rickshaws, and the private vehicles, they will get the opportunity to navigate. Okay, so those kind of concepts came in their approach. But now what we see after 1919 COVID pandemic, that this particular virus, particular pandemic has not left any planned, unplanned, any religion, okay, any untouched. Okay, it has affected each and everybody, depending on the preparedness or the proactiveness of the government or the local authorities. Okay, very quickly, I would like to show you the realities and the major observation from the planning angle. I would like to not to discuss in details of this. You know everything: restriction, physical distancing, surveillance, lockdown, test, micro containment zone, uh, etc., etc. Supply side, okay, everything. Earlier speakers told about that. Now, very important planning observations, which are not always negative. Very important observations are from home. You have seen that the first part or the first half of the 20th century, we focused more on the home work travel. Okay, home is somewhere, work is somewhere. Now we see that work from home, so distance between work and home is minimized up to a level of 0. We stay in a campus, the distance between our home and our office is like, by walking it is 8 to 10 minutes, and in cycle it is 3 to 4 minutes, by two-wheeler it is only 2 minutes. So in actual planning practice, can it be also a normal practice? So work from home has shown that yes, it is possible. Home delivery and e-commerce, which has changed the outlook towards the development of the commercial and the public and the entertainment infrastructure. Flexible land uses, we have seen that the stadium has become a makeshift hospital, the train compartments has become makeshift hospitals. Okay, streets which were ultimately designed for carrying the people, they were now carrying the emergency vehicles, emergency responses, etc. So flexible land uses, flexible design spaces. I tell you, in last 1 year, I have changed my living room at least 10 times, the arrangement. Professor Hajela was telling about the design and the adaptive reuse. Why not? I mean, this has been a very sincere observation from this pandemic, that that principle of flexible design, adaptive reuse, is not only in our house, it is required in every architectural building, every spaces which we create for in the city. Okay, that is a very close observation from this pandemic. Reduction of the assembly uses, okay, or what I say, that the revision or the change of the assembly uses. Localized incident management. We were hearing from Mr. Sen, Vinita Shetty, and Mr. Ajit Pai about the local management, the citizenship, empowered citizenship. You know, the 20th century, 19th century was for like the dynasties. The 20th century called that it was for the great nations, but 21st century will be for the cities. Think about the city which is having a population of 1.5 crores or 2 crores, a city like Kolkata or Delhi or Mumbai. It is very huge, very large than even a country, any country in Europe. Okay, so we need a dedicated incident management. Our secretary was telling about the ICCC cases. Yes, that was a very nice initiative. Why not we make it for the other, and also use it for the cities? Okay, so for managing this kind of incidents, always not waiting for the from the central government, state government. The city should work during the pandemic. Okay, and non-motorized transportation as a priority. Okay, one observation from the recent few research is that people are showing more propensity towards cycle and the tricycle or the non-motorized transportation if the distance between home and work, home and shops are very less. Maybe within 2-3 minutes they can reach. Okay, they are keeping the four-wheeler aside. So that is a very good observation during the pandemic. Now, the major learning from this uh, 100 years back practice and what we have seen this time is that planning as a quick reflection of pandemic was found limited. Okay, what the American cities tried to do immediately after the Spanish flu, okay, that has found limited because after 40-50 years they found that largely 100%, 90 to 100% cities they have made, but they have done some mistakes, and now they are making some corrective actions on that. So we should not make hurry. Only on the immediate or the symptom against the symptoms of the pandemic. Another thing, as I told, the pathogens are absolutely secular, equitable, and evolving. It does not live like plan, unplanned, any particular religion, any particular community, etc. Okay, I'll come to tell you few recent research highlights. So a holistic approach was missing. A plan is done for pandemic, must cater for the plan for other times. Okay, during the whole year. So how that holistic approach can brought into on the table. So the difference between that symptom driven versus cause driven. It is the time that where you are when you are facing the critical time of the COVID pandemic, there is a propensity to jump into the conclusion and making a symptom driven planning paradigm or change of planning. Rather, we should go into the cause driven, investigate the root causes, and then we should try to bring any changes whatever is required. Another thing, the planning as a service to build resilience. uh, uh, the classical practice of planning was like making a kind of the city development plan, the zoning plan, etc., etc. But now planning has become a kind of a day-to-day service. Okay, even the community community activities what we saw in the last presentation, you need meticulous planning to conduct a community activities like that. And it was a very fantastic presentation we have seen. So planning as a day-to-day service to build resilience within the community, within the people. Now I would like to share few early research findings because it is still evolving. People are taking more data and making the research. Now, the correlation between the COVID transmission and the microclimate and the temperature is not much proven. Earlier, people used to think that okay, colder climate may be having more propensity of transmission, but it is not. Maybe in some localized zone in the world it has been found, but there is no inconclusive proof about that. But there is a significant findings on that if you restrict or the limit the travel, okay, you definitely have the better air quality, except few localized adverse reporting. Largely around the world, it is a very good research finding that there is a direct correlation between the restriction on the travel and the better air quality. And Delhi is the largest example. Okay. Third, another very important research findings which came up in last 2-3 months is that there is a close relation between the mortality versus the air pollutions. Okay, if the city is less polluted, there will be less mortality, given other conditions are same. Okay. Another very important research finding is that this pandemic exposed the social inequalities. Okay, in disaster management we talk about the vulnerability, hazard, everything, etc., etc., but this has showed that if there is a social inequalities, the pandemic exposes that. Very recently we have done one project. Let me take the example that it was initiated by the Ministry of Panchayat and Panchayati Raj Government of India. just after the reverse migration from the city to the rural areas in the countries in the first lockdown in the last year, what they did, they tried to do a planning exercise in the rural areas. Okay, the main objective was that can we make rural areas more resilient, more stronger in terms of making people and their community and their livelihood through the spatial planning, through the land use planning, so that there is no forced migration. Okay, so that was a very good example. Maybe later on in some other occasions I will share that experience. Another important research finding was that whenever any city is having diverse economic, including home-based and the informal economy, they are much more resilient than a city which is having a singular economy. Okay, singular economy or singular source of economy. Okay, so from this perspective, the Indian cities are better equipped than any other European or the Western countries, because we have clearly diverse economies, including home-based and the the informal economies. Another important questions which came to our mind is that, is there any correlation between the density versus transmission of the disease? Sometimes we think that, okay, if it is a very highly congested area like Dharavi slum or any slums, okay, maybe transmission rate will be very high. But I am telling you that whatever research findings is there in the last few months, it is inconclusive, because there are evidence that even the density is moderate, the transmission may be higher, because there are many other influencing parameters. So density may not be the only parameter. So unnecessarily we should not jump to, like, reducing density or unnecessarily making the compact city as a sprawl or something like that. Similarly, as I told, temperature versus transmission, it is also inconclusive. Now, based on that, it is very difficult to conclude on a very pinpointed planning, change or revision. But a very broad direction what I can share. One is that instead of rigid regimental zoning regulations, we need a dynamic, flexible character of land uses. But the problem is that you ask the planner, many planners will not be able to answer this, that what could be the flexible dynamic character of the land uses. So that needs answer. Okay, so the Spanish flu, the post Spanish flu planning paradigm was segregated land use. Then the second part of the 20th century saw the mixed land use, and now we find a paradigm that we segregate the zones, but within the segregation we allow mixing. Okay, if we want to segregate, we want to segregate not this residential area from its necessary conveniences. We want to segregate the 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 polluting features. Okay, polluting features. So that's the changes in last 100 years. Cycle and NMT based is the answer. Okay, I don't need to mention this. Many cities in India have started. Yes, that's the future we should start. Now, in a city, the distance between home to work to entertainment and back, okay, the more the distance, more the number of trips, more the travel, okay, private and public transport, more the emissions, more the pollution, more the mortality, more the less resilience. So closer this network, closer this loop, closer the resilience, more the resilience, and better the planning is. We know that planning is basically knowledge in action. Therefore, the whatever knowledge we are gathering through this pandemic, okay, the main objective should be how we can make it in action. And having said that, let me just indicate few agenda for India. Okay, in my opinion, we should not hurry for a massive change in the planning approach. Okay, only for pandemic reasons. Okay, we need to study based on the, because right now there is no database. Okay, we need to take very important data. Second is that, and this is a cautionary note, that apart from the large cities and the second tier, third tier cities, there are villages in India. We know that it is governed by 73rd and 74th constitutional amendment. But I tell you that maybe you know that between the cities and the rural areas, there are non-municipal urban areas, which is in huge number, particularly a state like West Bengal. It is having more than 700, 800 non-municipal urban areas. The problem is that their their issues are urban, their development problems are urban, but they are living in rural areas, getting all the benefits of rural areas. They are unable to execute any urban services. Okay, eventually, if we cannot tackle this issue, there are many other states also in problems are there. Okay, these are going to be a next generation slums. In the secretary in his speech, he asked that why there are slums. So if we don't want slums in the future for making India a developed country, we have to revisit 73rd 74th amendment. Can there be another layer between the urban, completely urban, or municipal areas, completely rural areas? In between that, we have a Nagar Panchayat system in the country, but that need to be revamped in a different way. Okay, so this is a definitely an indication. Supply side versus the demand side. So always there is a balance between a build back after any disaster and the resilience as an inherent feature of a community or the city. Flexible planning and design, I told before. Citizens participation in the planning decisions. Now, citizen participation can be there in various layers. It can be like just making them participate in a small events to making them partner in the planning decision. Our objective is to bring them on the table in the planning decision, planning discussion. Only then, if they become a partner of the planning process, okay, our job will be partially done in terms of making people aware, the stakeholders accountable for the city's growth and everything, including the pandemic. So that's the major direction. We know that in 60s we had a national commission on urbanization. Okay, but we need immediately a long-term vision for urban India. Okay, long-term vision, a national pan-India policy. Okay, and not only the pan-India policy, maybe a regional policy in terms of the South Asian countries. And in this point, the role of the institute like SAIARD is very, very crucial in this moment. And I would like to mention this point: planning versus the making planning work. In National Commission on Urbanization, famous architect who was the chairperson of NCU, Mr. Charles Correa, he mentioned that our planning documents are sterile. Okay, those planning documents are there in the almirahs of the development authorities. We have to making them in work. Okay, so that's should be continued. And always there is a planning versus governance balance. We were listening from Mr. Devashish Sen's lecture that how the authorities like HITCO, NKDA, they are working day and night to reach to the people, population. They are making makeshift arrangement of the hospital beds in the gated communities. So these are very fantastic response in terms of the governance. So governance and planning should go hand in hand. So we need a better research paradigm for the future. I would like to conclude here with few of the future research, particularly in India. There is no specific, urban research agenda. We don't have many urban research funding agencies, no urban research policy. So I would like to share this, that at least these are the glaring topics we should take up in any forum, in institute like SAIARD, any other forum, like the city size versus the resilience, compact city versus sprawls, housing typology versus transmission, okay, open space versus the transmission risk, exact form of segregation and mixing of the land uses, municipal emergency plan, decentralized surveillance model, and do we need a revisit in the planning mechanism of smart city mission, Amrut, urban mission, Hriday, national urban livelihood mission, and other missions? Okay, so I'd like to mention this because our honorable secretary is part of this seminar. So this is also I would like to put in your field. I just take few seconds. That few works we are trying at IIT Roorkee. We tried to go into in-depth research to find out the Indian form of land use. We found the term like tonal land use, composite land use, as zonal land use as a very viable form of land use which we can use in different mixing different doses in the future cities. Okay, I would not going into much details. This we are trying to apply in the overall planning of the Patna metropolitan area. We are trying to making a new mixed use norms which is dynamic is in nature, flexible in nature, which is not stringent, but yes, it is firm in some of its provision. We are trying to make land pooling by cooperative, people's cooperative and developers, which is something new in the country. Create composite and the zonal mixed land use as the typologies we have developed in the institute. New road system, you know, the URDPFI norms, they proposes a road system which largely taken from the American system, which does not suit with the Indian cases. So we are trying to develop new road system which can cater to the people in mixed traffic condition, slow traffic condition, in pandemic condition, non-pandemic condition. This I have told. And also use of blue-green spaces as a means of segregation. Okay, we saw one slide in the last presentation that how the river bank, okay, large river bank in Jamuna river was used as a agriculture. In Patna, similarly, they have large river bank which is used for the agricultural purpose. So we are trying to use that in river banks and also in the planning region, not only for a urban farming, also to resist the urban flooding. Okay, urban flooding. So maybe in future, if I get opportunity in some other occasion, I'll share this experience in very details. I would like to stop it here. If any questions or any additions you want to have in this regard, it will be nice to put it forward. Thank you very much.
Thank you so much, sir. If any of the participants have anything to share, you may carry on.
Thank you, Dr. Roy. I know what is the situation you are going through right now, but still you have given your valuable time, and also our another resource person, Professor Hajela sir, also. So you are talking about new normal urban planning. So suppose there the points of smart city management and smart city management concept is there, and also Dr. Hajela sir told about the health concept, health related issues, health disaster resilience, all that. So in that case, in case of new normal situation, what we are already actually feel through our COVID-19 situation, the every system has devastated in a position, and this is nothing but a call the policy paralysis one kind of. So if we start from a very beginning, if we start from a very beginning to develop a city model, so which point we have to keep in mind in first, and which should be our priority basis in case of if we segregate, if we point out that these are the points which we have to mention 1 2 3 4 in city planning case in future also considering this new normal era. So which point we have to keep in mind, please?
Maybe Hajela sir, you can talk first. Yeah.
I think to me, everything should originate from people. I think people first policy should be the key driver for any developmental model that is to be undertaken. And I think if we are sensitive to the needs of the people, we use the model of design thinking as compared to critical thinking model, I think we would be more akin to the needs of the people per se. I think the previous speaker, Ms. Shetty, talked about this seeing the city from the at 900 MMI. I think we use the principle of 880. So something which is good for an 8-year-old is good for an 80-year-old. So if you can look at the principle of 880 and then design for these two conditions, I think it covers the larger cross section of society. I think it has got a great bearing of, in particularly in countries like India, where social sustainability is very, very critical. And I think it's been well accepted globally that in case things are worked around social sustainability, say social capital, and you are able to retain the social capital of any nation, which is the future per se, then probably all economic drivers and environmental drivers can be dovetailed to the social capital, and it's all should be geared to enhancing the social capital of any nation, and that's the resource. In case the communities progress, the nation progress, and I think everything can fall around that. And the design of cities, the creation of public spaces, the creation of places for the people, the human habitat, the work live relationships, the open and built form relationships, and I think all these are critical to the responses, and probably if it is done in sync with the nature, that means we try to conserve the nature and do minimum infringement to the nature. I'm sure we are going to create much better built environment, and which probably is going to last us for a much longer time. But I think some very interesting issues have been raised by Uttam, and I think they are all areas of very relevant inquiry and concern. Normally in healthcare, we do a lot of evidence-based approach is being pursued. So I think this pandemic offers us a great opportunity of looking at the evidences available to us and engage and correlate them to the planning principles, planning regimes, and probably find a way forward for better urban design and development of the country. So I think Uttam can add more to some of these thoughts.
Thank you.
Yeah, I would like to one point here. See, planners have largely two set of job. One is that development planners job, where the planners create the plan for a city or region or a village or a word, whatever. Another job is a development officer's job, okay, where they make the development work for the people, okay. Now in India, what happened, except few development authority, uh, these two are segregated, okay. The development planning is done by set A, okay, some set of planner. Increasingly it is being hired from the external agency, okay, and development officer's role is done by the engineers or any other person who doesn't have any as such knowledge of planning. So because of this gap or the discrepancy, one side you have the good plans or plans, another side you have application or action which has very limited connections with the plan, okay. If we can connect these two, okay, it can work. One practical problem is that in India there are not many numbers of planners where you can put the planners in the development authorities or municipalities, etc., etc. But I feel that it is possible nowadays. A lot of institutes are there. So this is one aspect, that connecting these two aspects. Another disadvantage of this gap is that planning is not becoming a inherent part of a city administration. Planning has always been like a kind of a a ornamental feature, okay. Ornament, it should not be. Planning is like a value system, it's like a principles of life, okay. So like we also follow the principles in our life, a planning or set of principles must be there from the day zero to even during the crisis period. That's need to happen. So if we want to fix that, we have to go into the planning methodology, the planning norms. We have to re-engineer that, number one. Number two, we have to work with the government to revamp the numbers of planner, okay. Number three, which these two may be short duration or maybe medium duration. Number three, what increasingly we are talking in these days is that why not a kind of a all India or the state service in dedicated in planning or the city management, okay. We have service for the administrative service, police service, forest service, foreign service. But where the people are living, we are dealing their lives, the built environment, there is no dedicated the public service, the cadet service in the built environment. So why not we kind of, I mean, it may be a little distant dream, but slowly we have to do. Otherwise, in the next pandemic, we have to bear larger cost. So these are three things which came to my mind at present.
Thank you, sir.
In
So,
fact, one small thing I would like to add to what Uttam just left, that
Sir.
I think we have to look at the urban governance model very differently. And the idea of ULBs, the capacities of ULBs, the potentials and the technical skills of ULBs, I think they are all very critical, need to be examined. I think the idea now should be that while we look at greenfield development through development authorities, we probably should be creating redevelopment authorities within our cities. In case we are able to create and establish redevelopment authorities, I think they will probably do far better job with better skill set. And in case we also end up creating a cadre, like what Uttam just mentioned, I think we will be able to reinforce both the developmental planning and redevelopmental planning in a more coordinated and organized. So probably here is an opportunity where the government can think, and these reforms are required in these directions. And the kind of the needs that we have in the 21st century, and the way they have to be addressed, I think they would demand lot of legal and structural changes into the system and the way we deal with them. Because the problem is the multiplicity of agencies. The problem is the same issue of, say, for healthcare also. We have a Panchayati Raj institution dealing with primary healthcare. We have the state health directorate dealing with community health centers, and then we have got district hospitals done by the state government, the central government giving other. So the problem is that there are too many agencies involved, and the left hand doesn't know what the right hand is doing. So probably has to be a better dialogue, better interministerial conversation, which ensure streamlining of the actions of the government for better action and effective utilization of resources.
thank you, sir. Thank you.
Thank you.
So, we have to go up for our next speaker. Please continue.
Thank you, Dr. Roy, for taking out your time and sharing your thoughts. Our next speaker is Mr. Vijay Sagar Varanasi. He is the Director Smart Cities at Quantella, a leading outcomes as a service company in the space of urban infrastructure digitization with more than 100 global deployments. Mr. Vijay brings with him over 18 years of global IT experience and more than 6 years of implementing solutions for smart cities and urban infrastructure digitization. He will be speaking on the topic of outcomes as a service for urban infrastructure digitization. Over to you, Mr. Vijay Sagar Varanasi, sir.
Thank you all. Am I audible?
Yes, sir, you are.
Cool, thank you. Firstly, I would like to congratulate the organizers for being able to bring in so many eminent speakers on very much relevant as well as very diversified topics that we have discussed on overall focusing on the main theme, the same main
Sir,
theme.
can you speak some loudly because your voice is slow?
Oh, sorry. Is this better now?
Yes, sir, it is.
Okay, sure. So as I was saying, so firstly, I would like to congratulate the organizers for being able to bring in so many eminent speakers who were on the same main topic, but very diversified subtopics that are presented very well. And I also like to thank Mr. Sujit for allowing me to share this stage and providing insights on this specific topic that I'm going to talk about. So starting with, I'll be structuring my overall lecture in 4 subtopics. So the main obviously is going to be the topic that we are going to discuss is with respect to the COVID-19 impact and on the smart cities. How can we plan better? And what will be the future of the smart cities? And how come an outcome as a services model help this overall? Okay, so the first topic out of the 4 topics I'll be discussing is the general smart cities, what has happened so far. Next is the COVID handling by the cities, how the cities have handled the COVID, considering the smart city infrastructure in use. And the next couple of other topics being COVID impacted challenges for the cities, as well as the last topic being the outcome as a service and overall financing models for the same. Okay. So starting with the smart city I mean, everyone knows smart cities. It's been a buzzword for a long time. So there are different explanations of what a smart city is, how a city becomes smart. So Quantala is into the smart cities business from the start of it. We have been working with the India MOVA for the smart cities mission. We also globally have 100+ deployments. So our definition, I mean, we provide technology for societies, and smart city is one of the society. So there are our definition of smart city is primarily urban infrastructure digitization through adaptation of purpose-built citizen-centric technology solutions. Now, obviously, each city will have its own specific priorities. It could be lighting, parking, waste management, or the urban overall landscape management, e-governance. So multiple priorities are there, but obviously it should be citizen-centric, and it should be based on a common platform which can bring multiple technologies on together into a single pane of glass, so that we can have a real situational awareness. We can better utilize the cross-domain analytics and provide actual outcomes using which the city will be able to benefit based on the smart city implementation. So some of the outcomes I would say are livability, right? The city should be livable once it made a smart city. The operational efficiency, environmental sustainability, equitable digital access, and economically prosperous city. Right. So these are some of the common outcomes. So depending on specific priority actions for the specific different cities, so their priorities might change. So I would say, I mean, we have global deployments and experience, and in view of that, so I would say India obviously has a very good advantage in terms of the smart cities implementation, and the credit primarily goes to the smart cities mission from the central MOVA, where they have developed this framework on how to implement these smart cities, as well as the guidance being given to the individual cities. And they have established a national urban observatory, the India Urban Data Exchange, so multiple ways where the innovation can be shared across the cities. And Quantala, as I was saying, so we in the National Urban Observatory is running on Quantala platform. So we are very closely working with how the cities can interact in terms of the knowledge. So the open innovation versus, or even the learning from one city being taken to the other city. Okay. Now we'll quickly go into how the COVID handling was done by the cities. Obviously, each city is presented with a lot of challenges with the pandemic. So some being with respect to the staff allocations, how do we actually take care of the regular city activities versus this sudden activities that came up with respect to the COVID. So when we say, I mean, people can only visualize to some extent of what actually is the work involved behind handling the COVID, right? So one is the hospital management, the bed management. So in which cases, how many cases are coming up, which area should we impose a lockdown. So there are a number of activities that need to happen, and to be able to take those decisions on each of these activities, there are a lot of steps that are involved in the back end. So the cities actually stumbled upon on how to take care of these activities. How do we collect the various case demography numbers, right? And then how do we analyze them and actually come up with some suggestions or actions. So all of that activities, obviously the cities with an existing integrated command and control center that is already established as part of the smart city has been on the forefront in being able to deal with the situation in a more effective way. Okay? And in addition to that, there are many cities which have also taken the digitization approach, though they don't have an existing integrated command control center. So they have also taken this opportunity to have a digital platform in place, which starts not only from the actual, the visualization is only an end output. So it starts from the field level. So from the field level, collection of the data from different areas, in which areas, how many cases are coming, integrating the data with various hospital systems, accordingly having some workflows in a particular area when it's a new positive case comes in. So what should be the next step? So there are a various number of steps that are involved and the workflows that are involved, all of which could be integrated into, again, the integrated command control center or any other digital platform that the cities can use. So Quantala has been working with multiple cities where we have set up these COVID war rooms The state of Assam is one example. MCGM Mumbai Corporation is another example. And obviously, we have done with 20 plus cities wherever we have our implementations, as well as some new implementations where these COVID war rooms were set up temporarily, especially in the phase 1, where the cities were not equipped with a lot of information and the systems to handle the load. So some of the outcomes that are immediately delivered after implementation of these systems is, so for example, if you look at it from a city which does not have this digital infrastructure, so they can only see that, okay, today in this city, I have 5,000 new cases, but which particular areas of my city are impacted? So when you put all of this on a map, right, so it automatically gives us the situational awareness. So on top of it, if we also put up the infrastructure availability, the logistics, so which area, let us say this particular ward number 45 has more number of cases versus the number of beds availability is very less. So we integrated all of those solutions together into a common platform and a ready-to-made cloud-based solution which can be deployed in 2 to 3 days with a standard set of dashboards, which provides a logistic awareness as well as tracking of the case demographic. And another important activity for the cities, it's a mammoth activity for them to actually compile the complete list of reporting requirements. From the city level, they had to report it and consolidate to the state, district level, and then state level, and to the central level. So the complete media bulletin reports or the case demographic reports to the center, so they all can all be automated. So through the digital infrastructure. So the smart cities have played a very crucial role when the COVID scenario came in, with a lot of city ICCCs have been converted as a COVID war room, and through the adaptation of other digital technologies. And this will not stop with COVID. There will be other challenges that will come up. This can be used as a crisis management software, and it is very important for the cities to embrace these new technologies and be ready to handle other upcoming challenges that will be coming up. So quickly going to the next topic on the COVID imposed challenges for the cities. So obviously, because of the COVID, so there are in addition to the handling the additional workload with the COVID, so the cities need to continue their existing activities. So they are cash strapped because of reduced, because of the lockdowns, reduced businesses running, the amount of taxes collected and all are reduced. So the cash is a problem. At the same time, there is more and more activities to be taken care based on the subsequent waves of the COVID. For the second wave, they need to plan the vaccination. They need to also plan for the future things. So, for example, it was, as rightly mentioned by the Commissioner sir, like in the starting, the first wave was primarily on the urban areas, but later on, it has been now spreading a bit into the second level cities. And in the third wave, it is expected a lot of rural areas and all also will be impacted. So we need to plan in advance. And it's not only the cities, but the overall country level, the plan need to be taken place. It might involve new infrastructure. So for example, village level temporary COVID clinic, which might not involve additional staff. So suddenly in a day, we cannot create new set of doctors, right? So we will have limited set of healthcare resources. So there could be temporary COVID clinic, which can just provide a teleconsultation, which even is a challenge in many of the villages where they might not be able to directly communicate to the doctors available. So if we have a teleconsultation clinic in different villages, the people might come there and we'll be able to utilize the digital infrastructure and connect with the doctors and get the appropriate first level help at least. Right? So that is one example. So there could be various other activities required, obviously with the digital intervention, where the digital infrastructure will continue to aid in the cities in terms of the crisis management as well as the overall city planning. Now, because of the strained funding, a lot of cities, even the India smart cities, a lot of the cities have always looked towards the federal fund to be able to start with the smart city implementation. So there are many cities which have come up with unique ideas on how they can actually generate revenue and then accordingly implement the solutions. But I would say they are still at a nascent stage. Some cities have gone ahead and done municipal bonds to be able to finance the overall operations. So that is a bold step and a step towards the right direction. So there are so now we need to provide solutions on how we can actually provide innovative funding to the cities to be able to continue investment on the digital infrastructure as well as the physical infrastructure, which is required for the smart cities and for the cities to be able to utilize all the available resources more efficiently. So another example I would say is because of the COVID, we know that a lot of people are now using the online mechanism, maybe for work from home or for the studies or for even a teleconsultation, even the e-governance services. So one part of it is the cities and whoever is providing this part, like the schools and all, to be having this digital infrastructure. But in addition, what is the reach of that in terms of different cities versus villages? So do the citizens or do all the citizens have really the reach? There is a clear demarcation that is created because of the digital divide. So, for example, if you just put up a small project where we are providing more Wi-Fi spots in each of these places, utilizing the existing Bharat Net program, and then maybe other private partners who can actually come up with, utilize the existing fiber infrastructure and then provide new Wi-Fi spots. Now, who will fund this, right? So the funding obviously is the challenge. So Quantella has come up with similar problems and solutions that we have implemented in other parts of the world. So one example I would say from Erie in Pennsylvania, which required this Wi-Fi as one of their primary use case. So what we have done is we have taken up their street lighting as an automation, where we have replaced some of the street lights with LED and implemented automation policies. And there are huge revenue savings because of the streetlight digitization. Now, on that savings, that is an anchor use case. So we utilize that anchor use case and then we fund the adjunct use cases. Similarly, there could be revenue savings or a new monetization part coming from parking, waste management, or traffic violation collection. So one of the cities where we have implemented our solution, in the last 1 year, there was 1 crore additional revenue in the traffic violations. So these are all additional revenue streams that can be created, or in some places it could be optimization of the number of waste vehicles that are going in and which all waste bins need to be collected to actually generate new revenue, right? So or the savings or the revenue. So these are some of the anchor use cases which can be utilized to fund other use cases which might not have a financial outcome, but it might be having other important outcomes like reducing the digital divide or actually providing some safety. So those kind of things. So those kind of revenues coming from these anchor use cases can be used to fund these use cases like this Wi-Fi. So that's the primary solution that we are suggesting is outcomes as a service and financing through it. So the financing part comes because the Quantella is also associated, like, I mean, this is just one of the ways to do it. So we are associated with a fund in US which primarily finances these digitization solutions. So the cities does not even have to invest anything into the solution. They just need to provide the permission to monetize some of the assets. And then accordingly, we create a revenue share opportunity for the cities. And then we also take up adjunct use cases which might not have a direct monetization output. And then based on the monetization output from other use cases, we can even fund these use cases so that the citizens finally benefit. And this is one of the key innovation, I would say, from the current scenario where the cities are fully cash strapped based on the COVID, and they still need to continue to move, especially to come out of the pandemic with by inclusivity to all the citizens. So another example, I would say, from one of the projects that we are doing in the Middle East. So there was this school bus. So there is a rule that no one should overtake a school bus in this particular country. So when when students are getting up and getting down. So on an average, there are some 25 to 26 violations per each school bus based on a study we have done. So we have implemented a solution we implemented the required infrastructure, complete digital infrastructure to capture the violations And then we have actually implemented that for all the school buses that are there. Now the city did not have to invest anything, but the final outcome is that we actually are making revenue in terms of the traffic violations. So, and then there is also increased public safety. So the overall public safety score has increased by 20%, and the revenue has increased by 40%. So these are a few examples, right? And another example from a regular smart city implementation in terms of outcome. So obviously, each of the smart cities will need to be will need to target the sustainability development goals. So the sewage treatment plants, the water quality levels. So each of these are important outcomes. So for those outcomes also, we have various cases where we monitor the STP levels and automatically alert back into the platform whenever there is any variation into the STP output levels, and then accordingly the corresponding action can be taken. So these are certain examples on how an integrated platform can provide various use cases for the cities to overcome from this situation. So there will be outcomes that need to be monitored. So in the initial phase of the smart cities, it was all just to integrate with the IoT devices and being able to visualize and having certain benefits. But as the overall smart cities mission has been improving its own objectives. So the current mission objective is primarily focused on the outcomes, and we provide outcomes as a service, and then there will be funding for the financial funding for especially for the cities where there is a cash-strapped scenario, as well as there are specific use cases using which we can do monetization, especially for some use cases, and then also fund the other use cases that are that might not have a direct monetization output. That's about it from my side. Any questions, please?
Thank you so much, sir. If any of the participants have any question or thoughts to share, you may carry on. Anybody? Okay, I think there's no question raised here. Thank you once again, sir. Thank you so much for sharing your thoughts with us in this time. Thank you.
Thank you.
Okay, our next guest is Miss Nirupama Sekri. She is an eminent writer, teacher, blogger, traveler. In the year 2000, Miss Nirupama traveled the country on trucks for 3 months to put together a photo documentation on the life of truck drivers who form a critical last mile link across all multimodal commercial vehicle operation. This secured her a prestigious Ashoka Fellowship given to Innovators for the Public, a global association of the world's leading social entrepreneurs. She went on to conduct a series of legal and health awareness workshops with transporters in Delhi's sprawling Sanjay Gandhi Transport Nagar. Following this, she worked with a range of organizations on communication programs, including with Association for Intelligent Transportation Systems India and Institute of Housing and Development Studies, where she coordinated a best practices visit to Bangkok and Sydney of a group of local urban officials for water and waste management processes. She also conceptualized and edited DWM's newsletter, Delhi Waste Management, the biggest partner in waste management when Delhi opened to public-private collaborations. Presently, she teaches communication skills to children and writes on a freelance basis for a range of publications, including Times of India, News Laundry, South Asia Monitor, The Patriot, etc., on human rights and development issues. She will be speaking on the topic of imaging the cities of tomorrow. Over to you, ma'am. Ma'am, are you there?
Ma'am is showing in the list also. Nirupama ma'am. Let's wait. Sorry, there is some technical glitch. Ma'am is joined once again. Vijay sir, thank you for your wonderful lecture. And on behalf of our CUBE, the Center for Urban and Built Environment, we are also focusing on smart city related activities through GIS remote sensing platform. So I will communicate with you in future. Thank you, sir.
Sure. Thank you. Pleasure is mine.
So ma'am, are you here? Nirupama ma'am? Okay, she has left. 1 second. Ajit sir, thank you for staying with us.
Not at all. It's been extremely informative to listen to everybody else. So some very valuable perspectives over there.
Yes, sir. And during this lecture session, even you, Amit Hajela sir, and I have also put some points for which on we are planning to organize these kind of activities in future also, and it would be much better. And I have a plan to invite other state councils as that they can be a part of that webinar or discussion. Ma'am, am I audible? Nirupama ma'am, please unmute yourself. Yes, ma'am, please.
I think Nirupama ma'am is having some technical glitches. Please bear with us, everyone.
Whenever you're ready, just tell me. Yeah. Should I begin?
Yes, ma'am. You may start.
Yeah. Okay. Yeah. So I just want to start off with saying that I think it's not a lot from the past, but because there's uncertainty and there's such collapse of necessity, and I think people who have risen to the occasion, individuals, organizations, small organizations. So today, if there is a problem, people are reaching out to people who are connected. So I think that is something that the entire idea of smart cities needs to learn from citizens. I think what Jackie said about cases. I think it was 15 years ago when I was working on this project. Something called ICS and we took a group of city activists, Highlands and citizens for water management, solid waste management practices. And then this mode. That I didn't understand.
So it has been muted, ma'am. Nirupama ma'am.
Begin.
Yes, ma'am. You must start.
Yeah, so like I was saying, so there was this, she pointed out.
Yes, ma'am. You are disconnected now. Tell.
So I think housing thought through the thought through more smartly because it's unhealthy. It's unhealthy physically. It's unhealthy mentally for people to be pushed in such more learning and access. Exactly like Jackie said last year that the that was here in the country, there were certain houses to go out and walk. And if you have no access, what is there? Not possible. So yeah, idea of housing something thought about and people show that more people have access to the housing and the quality of housing that as well. And just one more thing I'd like to talk about what Sorry said about the construction. I think construction is emergency. I mean, there might be in traffic right now. Yes, well, they're not using enough money. So that demand, supply, the movement, all that I think can really looked at. And then this rationalizing of land use, which I think most of the professors spoke about, that I didn't get. And over the years, I have seen so many. Over the years, I've seen so many government mode. I've seen so many government buildings come up, and so there are sprawling offices for many social.
Bluetooth mode turning on. Now is oxygen mode.
Yes, ma'am.
Yeah, so it's like rationalizing land use because it's so expensive. I mean, houses have skyrocketed cost. So land is such a precious commodity, and yet it is so casually used in terms of auditing. So you have so many office, government departments, and but what is their output? I think that whole auditing, both in terms of space and in terms of output, is really important because it's interesting how everybody talks about slums, quarter colonies, but you have, one officer who, if you look at the amount of space, one person or one family working with a government institution, it's incredibly huge. You're living in a huge luxurious bungalow, you're going to a huge office, while you look at, a slum dweller who is living, working in such tiny spaces. So I think the whole auditing process has to be a little bit more rationalized. And I think that's everybody's spoken so much. I think that's about it. And I think smart cities can't be islands. I don't think anybody can plan anything if you have hundreds of vehicles and hundreds of people pouring into the city on a daily basis. So I think smart cities need to have linkages with policies and their states around. I mean, this entire thing about slums, for instance. There's no law, for instance, for informal labor. We can hire and fire people working in our homes at any, at any cost. Now, if we had certain restrictions on how much we could pay them, how their housing would be, would automatically have a more coordinated approach how human resource is being used. So I think it's a big challenge, and I really hope that this pandemic helps us rise to it in a kinder way and in a rationalized way, where things become much better.
Thank you, ma'am. So though there is some technical glitch, but still, thank you for your lecture. And I think now we are going for our valedictory session. So please, Ms. Kundu. Thank you, ma'am. I will communicate.
Yes, so thank you, Ms. Nirupama Sekri, ma'am, for your words. Now I would like to request Mr. Manas Shudaid to give a vote of thanks to everyone.
Thank you, Anthura. Am I audible?
Yes, sir, you are audible.
Okay. A very good evening to all, to one and all present here today. And it gives me an immense pleasure to deliver the vote of thanks for the event to the dignitaries assembled here. I am very honored to experience such an auspicious program and being amongst such great personalities. Firstly, I would like to thank none other than our very own chief guest, Mr. Durga Shankar Mishra, for taking out his precious time for us and for imparting his knowledge with us. I would like to thank our guest of honors, Mr. Devashish Sen sir and Mr. Ajit Pai for their valuable lecture, for their guidance, and for their path they are showing today. I'd also like to thank the other resource persons, the speakers today, Ms. Vinita Sethi, Professor Amit Hajela sir, Dr. Uttam K. Roy, Mr. Vijay Sagar Varanasi, and Ms. Nirupama Sekri for enlightening and for imparting knowledge on such important topic with us. I would also like to thank our very own chairman, Dr. Vishwajit Roy Chaudhary, and also Mr. Arindam Roy for arranging this webinar and for their inaugural speech. Lastly, I would like to thank our very own audience for sticking with us through the entire event. And also, not last and not the least, Antora, who is act as a moderator through the entire session. I also thank Antora for that. Now, I would like to conclude this program by thanking everyone for taking out time from their busy schedule for this webinar. And I hope that everybody is doing safe during this pandemic situation. Thank you to all of you.
Thank you.
Thank you, everybody.
Thank you.
So,
Thank
on
you
behalf
all.
of SAIARD, hope we will get you and your assistance once again in future also. So it's really a wonderful webinar we have faced, and Vinita ma'am, Amit
Thank
sir,
you.
from sir, everything on everybody on behalf of me, Ajit sir, Varanasi sir, Nirupama ma'am, so even Devashish sir who are not in present yet. So and already they were Durga Shankar sir messaged me that it's really a wonderful initiative you have taken and you should take a lot this kind of. So definitely sir, we will taken a lot of programs, and very soon we will come to all of you with a new session and with a new discussion. And I have pointed out, as I told Ajit sir, I have pointed out some points that in future I have a plan to organize an urban governance related program, workshops, all that. And definitely I will call to all of you, Yan keeping this. So be safe, please be safe. This is the very crucial time for us. So we have to save and we have to do for our future. Thank you. Namaskar. Thank you.
Thank you.
Thank
Thank
you,
you, everybody.
everyone. Stay safe. Good night.
Thank you. Thank you.